All right, Eric, we're gonna rock and roll. It's 9 o'clock.
Let him do CRA first.
Oh yeah, that's right. If Lumen's ready to go. I don't even have that. You guys ready? All right, Lumen, you ready to roll on your CRA? Yep.
Community Redevelopment Agency, regular meeting, January 6, 2022, 9 o'clock a.m. Please turn your cell phone to vibrate, silence, or the off setting. Is there proof of publication?
Yes, this meeting has been properly published through the Escambia Sun Press on December 30th, 2021.
Thank you, Tammy. Are there any speakers for public forum?
Not that I'm aware of, Commissioner.
Thank you. Technical and Public Service Consent Agenda.
One item, recommendation concerning CRA meeting minutes, December 2nd, 2021.
Move the item.
Second.
We have a motion and a second. Please vote. Pass it 4 in favor, with Commissioner Underhill off the dais. Budget and Finance.
There's two items under Budget and Finance. The first is recommendation concerning residential rehab grant program, funding and lien agreements. There's a Part A and B for review and approval.
Move the items.
Second.
Motion second, please vote. That passes unanimous.
This is the final item. It's recommendation concerning residential roof program, funding and lien agreements. There's also a Part A and B for review and approval.
Move
Move
the
A
item
and B.
A and B.
Second.
We have a motion by Commissioner Berry, second by Commissioner Bagash. Please vote.
Aye.
That passes 4 in favor with Commissioner Underhill off the dais. Thank you. Is there anything else?
Nothing further, sir.
Is there anything for discussion? I do want to encourage CRA. I mean, some of the things, the roofing program is great, and, you know, that's impressive doing after a hurricane and a disaster that we're still able to help people, so I applaud you for that. I certainly want to encourage you to continue to work with Claire. Some of these programs that we've done in perpetuity have certainly just not worked, such as a paint facade. It's just putting lipstick on a pig. For me to continue to support, I can't support programs like that. We need to be more innovative and more aggressive in changing our approach to the current conditions. So I would hope that as y'all come forward in the next month or so, that y'all will come back with some newer programs.
Yes, sir.
Those that are working, great, but those other ones that we've just done in perpetuity to just do them for longevity's sake has not benefited the districts that I represent.
Understood.
So, I appreciate it.
Thank you.
Is there anything else from the, if not, we stand adjourned. Mr. Chairman, all yours.
Thank you, Commissioner May. And we'll just give him a few minutes, a few seconds to switch it over. You good to go back there, Andy, if we start? Good to go. Okay.
All ready to go. Good deal.
All right, good morning, everyone, and Happy New Year. This is the agenda review session for our regular Board of County Commissioners meeting that will occur this evening at 5:30 p.m. So we're going to go through this. Each of us have had the opportunity to extensively study this agenda for the last 3 weeks and have our meetings individually with staff members. So we're going to go through it rather quickly because most of us are very, very well versed in what's in here. But we are going to go through it. Start out with the invocation this evening. Commissioner Underhill will be bringing the invocation. Commissioner May, would you lead the pledge?
Yes, sir, I'd be happy to.
Commissioner May will lead the pledge. And now we will talk about items added to the agenda after the last civic clerk update. Are there any additions to this agenda post the last civic clerk update? And there will be from you.
Yes, sir. On behalf of your request, Ms. Cronley's term on the TDC expired at the end of November. So
Correct.
we'll be doing an add-on to make sure that her new 4-year term gets before you this evening.
Thank you very much for doing that. Okay, and I'm sure you will have one other one. Is that correct? From?
Yes, there may be a settlement agreement related to it.
I'm not going to even hear that may. It's going to be.
Yes, sir.
Thank you. All right. Commissioner Bender, do you have any add-ons tonight?
No, sir.
Commissioner Berry? Commissioner May?
I don't think so.
I won't have any that are not already on there. I may piggyback on the Pine Forest football, I believe, Commissioner Berry. And there's one that I might piggyback, Commissioner May as well, on one of the ones that you've done. But okay, we'll do a brief commissioners forum, or we could do it this evening, but I'll leave that to each of your discretion. We'll do it this evening.
Do this evening. I just want
All
to
right.
thank Commissioner Bender for that beautiful card.
Well, thank you very much. Yes.
My wife didn't get it, but I got it.
And just
It was very thoughtful.
Just to let everyone know, as soon as Marie Mott arrives, Eric Gilmore is going to give me the high sign. We're going to bring them up for a update on COVID locally and in light of the spike of the Omicron. So we're moving on to proclamations. The proclamation to adopt commending and congratulating Carlos Arona, a paramedic in the Emergency Medical Services Department, for Employee of the Month. And I assume Eric Gilmore will be bringing that one? Okay. Next proclamation, adopt the proclamation recognizing the month of January 22 as National Blood Donor Month and applauding and commending One Blood for the work they do in this community. Who will be bringing that one?
That one will be presented at a
Separate event, okay. So that one will be presented tonight. Okay, item C, adopt the proclamation commending the good work done by the Cantonment Improvement Committee for the work in their local Cantonment community. Commissioner Barry, will you be bringing that one? Okay. And item D, ratify the proclamation dated December 10th. So we'll be ratifying that, and we'll just vote to do that. All right, moving on to 7, did the clerk's office receive the proofs of publication? Of course, I'll ask you tonight too, but we did? And
Yes, sir, we have received them all.
And in the Escambia Sun Press,
In the
correct?
Escambia Sun Press, yes,
We
sir.
love the Escambia Sun Press. God bless them. Okay, Clerk and Comptroller's report. Madam Clerk, you're recognized.
Thank you. We have 4 items on the agenda for your review. One is the investment report. The second is the TDT for November 21. There's also minutes that we filed and reports. More importantly, we have finished our UKG conversion, the payroll conversion. Are there hiccups? Are there bumps? Are there problems with employees' pay? Yeah, it's going to happen in conversion. However, we're working really closely with Crystal to get anything like health insurance pay, overtime, whatever it is, staff, your staff, my staff, untold hours. The exempt employees have put a lot of time in it. That would be your directors, your managers, as well as mine, as well as a lot of overtime for regular staff, but it's going well. The second is we're completing the audit. This is just a financial audit, present fairly of the county, and that'll wrap up in good place.
Fantastic.
Thank you, sir.
Madam Clerk, is the EFIN 50 functionality still there, or is this all over?
EFIN will be replaced this year.
This year, but
We
for
will
now, we're
start
still-
going out, right, we had to do one step to the next, and we have a requirement that's going to require us to be more transparent. OpenGov is a prime example of what's going to be required of us in the future. In fact, they're working on a module for the financials, so we'll be looking at that. So we'll get that changed to make sure that it all is interfacing and transparent.
Right on.
Yes, sir. Thank you.
Much appreciated. Anything for the clerk? Okay, moving forward, growth management report. Horace, you're recognized. Do you want to run through these with us? Happy New Year.
We have the growth management report. We have the rezoning cases as listed therein.
And did we, I had my review with staff, and I just want to make sure, at our last meeting, these were kind of the way they were stacked, the
We
votes?
got it to, yes, sir. Everything has been corrected. We will be going by each one. Yes, sir.
Thank you, Horace, for that. All right, and
Then we have our 545. That's the adoption of the official zoning map.
sure.
Then we got to take one of these out of order. We got number 3. That is the small-scale map amendment, which must come first. That's the ECUA. That one got to come first.
Okay.
Before we do the rezoning. Then number 4 is the rezoning cases that was previously heard. Number B is the rezoning for the ECUA property.
Okay.
We have the 547, adoption of the official zoning map for the rezoning property. Then we have the 546. This is a development agreement for the Wildwood Estates. We have the several GMR actions. We have
That was a 548, right?
Yes, so 548, that's the development agreement for Wildwood Estates. Yes, sir. We have the GMR action. We have the planning board, I'm sorry, Board of Adjustments at-large position. And number 2, this is the final plat for Iron Rock. At the request of the applicant, they are requesting for this approval for the subdivision of Iron Rock be moved or rescheduled to the 18th of January.
18th of January, so item 2 under GMR actions going to
Yes, sir,
18
for Iron
January.
Rock final plat.
Okay.
At the request of this. Then we have our GMR agenda for February the 3rd.
All right, Horace, a couple of things. Going back to the ECUA issue, this is not approving garbage transfer. This is simply a rezoning and a future land use request that they've made, and we're going through the process of that.
Yes, sir, for
And
the land only.
For the land, for the use, for the zoning, and then the planning board has approved this.
Yes, sir, the.
Planning board has approved this, 'cause
Planning board, yes, sir. the
I'm getting a
recommendation-
lot of emails about the trash dump transfer station, but that is not what we're approving tonight, correct?
We are approving.
The zoning.
Future land use category change and the rezoning if the board so chooses.
Yes, and then so any further development of the site would trigger your DRC process, and that would include public input, correct? And public meetings?
There, well, the DRC process does not necessarily have direct public notification, but it will be on the, it will be scheduled on the website. And for anyone that's listed, they can come in, they can talk to us, they can come to see the plans. All those will be transparent and
Okay.
open to the public once we get to that point.
But we're not there yet.
No, we're
Okay.
definitely not there yet.
Just wanted to take a minute, thanks for your indulgence, just to make sure. I appreciate that. Then the final thing on the consent agenda, gentlemen, next month, there's a bit of a conflict at the beginning of the month, and I've asked staff to combine our February 3rd meeting with the February 10th Committee of the Whole in order, I'll be out of the country for the first week of the month, and without objection, I would prefer to move that meeting and combine them together into one meeting, and Wes is going to be sending out a memo. But Horace, instead of the first meeting being February 3rd, I would propose that we move it to February 10th and combine it with any items that would be on the Committee of the Whole.
So you want to do a 9 a.m. February 10th regular BCC meeting with an 8:30 a.m. public forum?
Yeah, that's what I'd like
I
to do.
just want to make sure, because for Horace's gang, they're going to have to make sure
Yeah.
all their ads
I
are
mean,
adjusted.
unless someone has a major objection, that would be my preference.
I mean, we're just going to eliminate the committee of the whole then?
Or I mean, I don't know what we
I
have.
know you said combine it, but I mean.
Combine it. You want to eliminate? Okay. Okay, then we'll eliminate, we'll just have the regular meeting on the 10th, if that's.
A regular board meeting and no cow.
Nope, no cow.
Just trying to make sure everybody
You guys good
understands
for
what we're doing.
8:30 in the morning and then 9 o'clock for the regular meeting?
For the land use stuff, do we need to have one nighttime meeting next?
So
in
I don't
February
think
then?
there are occasionally obligations that one of two, when you have one of two public hearings required, at least one has to be after 5 p.m.,
Mm-hmm.
but I don't see that that's going to be a problem for this particular month.
Okay, I appreciate that, gentlemen, thank you. All right, so our first meeting in February will be the 10th. It'll be an 8:30 public forum and a 9 o'clock regular meeting, and all these items that were listed for the 3rd will move to the 10th.
Yes, sir.
We're all on the same page. Okay, fantastic, very good. We're moving forward now. County Administrator's Report. You want to go ahead and read them down, or you want me to go through them? Okay, all right. Number 1, recommendation concerning Community Redevelopment Agency meeting minutes. I'm going to just look for lights, guys. We're going to move quick. Number 2, recommendation concerning a resolution for a temporary road closure for a resurfacing, restoration, and rehabilitation project on State Route 10A. That's a very, very big project in my district, and it's going to be very helpful to all the commuters going in and out of Beulah, so we look forward to that. Number 3, recommendation concerning a request for disposition of property for the Public Works Department. Number 4, recommendation concerning the contract for the Florida Department of Health in Escambia County. Oh, and that's a perfect time to segue. I see Marie Mott is here, so at that point, gentlemen, without objection, we're going to go ahead and bring Eric and Marie Mott forward to give us an update, and then we'll pick up on 5 when they're done with the update. So Eric, when you get to the podium, you'll be recognized.
Good morning, Commissioners. As everybody's well aware, we have been in close contact with our hospitals since the trending end of the Delta variant, and we've maintained contact with our hospitals and decided that 50 in-house patients was going to be where we started the dashboard again, and we started ramping up our processes for requests from the state, for resources, for testing, for monoclonal sites and things of that nature to help our healthcare partners in the community. Unfortunately, this week we did hit over 100. We had 104 Monday in patients and patients in hospitals. Today we're at 129. During the Delta variant, we saw a sharp increase in positivity rate in conjunction with a sharp increase in in-house positivities. We're not seeing the sharp increase in in-house positivities, but nonetheless, we're still having people in the hospitals. So this morning, yesterday we had 116 in the hospitals, and this morning we have 129. So working with our community partners in our hospitals, Community Health Northwest Florida, we're starting, Sacred Heart has already done their testing sites. They already opened their testing site back up to help ramp things through. And we heard yesterday they had a 50% positivity rate at the testing site. We all knew that we was going to see an an increase in positivity because Omicron seems to be spreading more rapidly than it did the Delta variant. So we'll see increase in positivity, but we're really, we're watching the hospitals, make sure our in-house patients don't sharply increase as well, and the hospitals are still able to sustain what they're supposed to do with the patients. DOH has always been testing. You can still do testing through walk-in and, through appointments. And then they're also working with a vendor to bring a vendor into the community to help do some testing, and I'll let Marie touch on that. We did request yesterday through the state monoclonal site, and we've heard Regeneron is not the drug of choice for the monoclonal treatment, but there is another drug out there that seems to be beneficial. The state has told us they're not going to put any sites out. Fort Walton Beach is still up and running. As far as we know, they're limping it along with what resources they have to keep that site going. But as soon as the state of Florida receives more resources, we are subjected to get a monoclonal site here with the new drug that's supposed to help with the Omicron variant. So we've done everything we can right now to stage everything up. To include the dashboard to get the information out there, and we'll continue to do that throughout this increased positivity rate and hospitalizations. So, Marie?
Eric,
Yes, sir.
so I know I was actually at CVS yesterday, and we've gotten phone calls. Are we able to meet the need of people requesting testing right now in Escambia County?
As far as testing goes, Marie, can you?
I know some people, I've heard people were in line and it got closed off at certain sites, and they weren't able to see all the people.
The capacity for Sacred Heart, I think they did 600 yesterday. I don't know what their absolute capacity is, what they can do a day. I do know that some places, Marie has, I don't know how many appointments you have, Marie. Do you want to speak about
And
testing?
Eric, I'm not really concerned about that. I want to provide you the resources.
Right.
That if people want to get tested and want to get vaccinated, that we are getting those resources in place in Escambia County. I mean, so that's kind of what I would
That's what
want to
we're trying
hear.
to do,
Because what I'm hearing just from lay people is that, some people are wanting to get tested, testing sites are closed, or I get there after 1
think you
o'clock, or I've been in line, I can't get it. And so that's very important that
Yes, sir.
we set up the resources. I mean, that's why we got rescue money. That's why we got the state. I mean, everybody that wants to get tested, everybody wants a vaccine, should be made available here in Escambia County.
And that's what we're trying to do, right? We're trying to make sure that everybody who wants to get tested, the test is available for them by multiple venues, through the health department, through private partners, through the hospitals, and through the vendor that they're going to bring in, the contractor. So
And that's the few, but as of today, the need is greater than the resources.
it appears to be, yes, sir, right now, today.
All right. And we're not kind of keeping up, there's no data tracking with that.
With the testing,
Yeah, well, with the amount
With the
of
demand.
requests versus the amount of supplies.
right now, no, sir. But we are hearing, like you said, you're hearing rumblings, I'm hearing rumblings as well, and we're trying to get those resources in,
Yeah.
so.
Yeah, I mean,
Now-
not only did I hear it, I mean, I saw it. I mean,
Okay.
I don't have any factual data.
Right.
Other than my own observation, which does weigh somewhat with me.
Yes, sir.
To make sure we get those resources.
Now, testing and vaccines readily available. So anybody who wants to get the vaccine, they can get the vaccine. It's available.
And we're doing one at Brownsville this Saturday.
Yes, sir.
Right.
So community health's been great getting out there in the community and doing it. And community health is actually doing testing today at Brownsville as well. So that's another venue that we're trying to get stood up to help out. So
Well, yeah, I just want to make sure, Eric, that you understand from my position, whatever resource we got to get people
sir.
tested and vaccinated, we need to do.
yes, sir.
All right, Marie, thanks for being here this morning.
Sure thing.
You're recognized.
Okay. And I was just wondering, Commissioner May, do I need to add to your conversation with Mr. Gilmore, or is that?
No, I mean, are you seeing, I mean, I guess my only question was, Marie, was, were there people wanting to get tested that couldn't get tested? And that was,
And yeah, other than basically what he said. We don't have any hard numbers, but yes, we're hearing that as well, and working to make sure that any gaps that can be filled as quickly as possible.
and when are we going to mass distribute the home kits, Maria?
The home kits are, we have them available and are handing them out to symptomatic people upon request. We have shared them with Community Health Northwest Florida to hand out as well, and are looking at other partners who can get them out to people. The ones that we have in our possession right now are require a smartphone and some, the ability to kind of download an app and go to a website, and
Yeah, that one wouldn't work for me. I have a track phone, but.
they're not very simple, but they are effective, and they can only be used for symptomatic people. For that reason, we have appointments for asymptomatic testing, and it brought in or have been soliciting opportunities for the state contractors to come in to set up testing, which should actually be opening today. The press release is in my phone waiting for me to look at it, and they are setting up and setting up a soft opening right now. So
Will you be getting the home kits for asymptomatic people as well? Will you be getting?
I have not
that?
heard of any resources for any type of home kit for asymptomatic testing.
Okay, thanks.
All right.
Let's just see. I brought these resources just to, in case there were some visuals that we needed. Just to remind everybody, the Florida Health COVID-19 website is a source of information, as is the CDC website, and they have a data tracker there as well. So a lot of these visuals come from the CDC website, including this snapshot, which was through January 5th. Looking at the case rate of 678 per 100,000 people population. And that's a relatively high rate, comparatively speaking to previous weeks. So in percent positivity, 37.8%, again, another high percentage. Yesterday's returns were kind of mirroring what Eric said Sacred Heart had at their testing site, close to 50%. Today, I think it's a little bit lower than that. So, again, looking at weekly case positivity in a visual, you can kind of see the peak that we're in, or the surge that we're in over here on the right side of the slide, compared to October, November, where we were running around the 3 to 4 to 5% positivity. And then that's the case rate curve as well. These are from the CDC website, so this is something that you can access on a daily basis. And the slider right here can compress the timeline in case you want to look at a closer window. So this is kind of the whole pandemic, and this one is the last quarter. And just put this in case there are questions about Omicron and the percentage of Omicron. And you can see region 4 is where Florida is located, and you can see that the purple, I don't know if you can see it because it's kind of small, but the purple bar is the Omicron bar. Mm-hmm. So, quite a large percentage of Omicron in this area.
Sorry. Jeff, do you mind? Yeah, please, Robert.
Do you mind going back to that real quick?
Sure.
To the map? Where do we think that they've already had the Omicron surge, or what's ahead of Region 4 to see how that comes back around, or what are we thinking of how long this current spike will, or how long before we spike? Is there any discussion on that?
Again, just kind of general discussion, nothing specific. I think the rumblings, I guess the word of the day that I get is, sometime in the January, February, time frame.
Do we think that Region 1 has already had the spike in Omicron, or is that, because you see like 1 and 7 are more of the Delta variant than the others? Do we know, has that been considerably smaller, or is that?
I don't think I could answer that right now. I could try to find out for you.
All right, thanks.
All right, please continue.
Okay. There's information here on vaccinations in terms of population vaccinated, and you can see we are kind of in the 60% at least one dose and over 50% fully vaccinated in our community. This is specific to Escambia County. And then the booster doses from the CDC standpoint website. You can see our weekly kind of uptake. Oh, I didn't finish that. I think I grabbed the wrong slide on that one. That's an old one. Sorry.
I was going to ask you, did that downward trend continue into the months of fall and winter?
The downward trend in...
One back, where you had the wrong slide. It showed August, where starting at the 5th of August, there was a downward trend in the total number of vaccinations.
In that weekly vaccination.
Do you know did that continue?
If I recall, it kind of did, and it has kind of spiked back, picked back up a little bit. Like I said, I didn't change that slide out. I apologize.
Marie, did we get the childhood cases that, are they broken out in the childhood cases that we have for COVID?
I don't have that handy. I think I can try to get that.
Can you, and the concern is, the school cases and what's happening with our teachers and our children. And so I know there's a great concern by educators about what we're doing with children.
Yeah, I can see if I can find that information. And, I did talk to my school health program director this morning to see what she was hearing from the school system. And they are seeing some cases in the students and the teachers, but they would have probably more accurate information directly from the school district.
Well, I can tell you every basketball team in Escambia County has been adversely affected by COVID when many kids are having to sit out, and it's already happening. And it's after this presentation, but I certainly would like to have the discussion about the childhood cases, what's happening in the schools, and the availability for teachers and students who need to get tested, and many sites are closed once the teachers and coaches and athletes can leave campus. That seems to be somewhat of a little bit of a problem.
Right, and I think, bringing in the state vendor to operate some testing, one of the things that we're asking is extended hours, so that those type of opportunities don't get missed.
Right. I think that's what's happened. The athletes were, and thank you for your office help and Dr. Phillips. Y'all were very cordial to many of the athletic teams who were having to cancel over the holidays, but it seems to be a problem, particularly when young people who have been staffed to school not getting done to 5, and coaches who can't get off campus at 5:30 or 6, they have nowhere to get tested. So if we could be of assistance with that, or if you could address that, we'd certainly be appreciative.
Okay. And again, you can see from the CDC website the testing increase as well over the last quarter, actually the last month of the last quarter. Hospitalizations, just as Mr. Gilmore has mentioned, some increase in hospitalizations recently, which has gone with the increase in cases, which is what you typically expect to see. Not quite like it was last summer, from what I can understand from talking to the hospital personnel.
So, Marie, we always have concerns with after the holidays. Is there a big concern with us going back in school this week of hospitalizations going up, or the spread being even wider with school back in session? Are there any concerns from your position?
I think generally that is a concerning situation because you have more people together that have been probably traveling and with other people. And so, being vigilant, monitoring, encouraging people to stay home when they're sick, trying to get them tested as much as possible. The hospitalizations usually follow a couple of weeks behind case increases. That's just kind of what we've seen, in the past with this pandemic. So time's going to tell.
Yeah. Well, I know our wonderful Surgeon General wants to get herd immunity by letting everybody get it, but I don't think that works. But, one concern that I have is that people who are testing positive, but they have family members who are asymptomatic, but the asymptomatic people can't get home kits. Is there any approach that we're going to be able, people are living with people who have COVID. The person with COVID can get a home kit. The person living with them can't get a home kit. So now they have to come back out into the general population carrying the spread. So is there any hope that we'll be able to get those people who are living with someone who's positive a home kit?
I haven't heard of any resources for home kits coming through us. I think you can go buy them in the pharmacy. But again, the other way to address that hopefully is through these drive-through clinics that either just Sacred Heart has, their drive-through testing, and the contractor that we have coming in to set up drive-through testing.
Well, right, and part of that, it's above your pay grade. One, when we're dealing with health detriments and disparities and disadvantage and poor, it's not just that simple to go purchase. And if you're living without transportation, it's just not that simple to get in a car and go to a drive-by when the person in your home is able to get a kit. So, if in your conversations with our friends, and I'm going to obviously have this with our delegation, it seems that a common sense approach would be if one person in the home has COVID and is testing positive, that the other people are very vulnerable, particularly in vulnerable populations, that they could get a home kit as well. And so, I mean, that's kind of disappointing that they won't give a family a home kit when they're living with someone that's positive.
Right. Well, I mean, currently the kits that we have are not effective for asymptomatic testing. And so that's kind of where that guidance comes from, is that people that have symptoms can use these to test and get a good result. But people that don't have symptoms, the result's not reliable. If there are resources that may come down for use for asymptomatic people in a take-home manner, I haven't received anything like that yet.
Right. And all it correlates is that minority testing rates and poor people testing rates are very low. And so, I mean, that access is important. So anyway, I'm messing up your presentation. I'll wait till the end. Sorry, Marie.
That's okay. I think we're getting close to the end. Like I said, I had these kind of for resource. So getting to testing, just to kind of reiterate what Mr. Gilmore said, we do have appointment-based testing at Fairfield Drive for asymptomatic or symptomatic people. We do make the take-home kits available for people with symptoms. And the appointment line for COVID testing appointments is option 6, 595-6500. Option 6, the drive-through contractor is setting up this morning, and right now they're setting up in that parking lot across from the central office complex, or the one-stop shop, kind of behind the Waffle House. And so one of the reasons we like that location is we have eyes on them, and they're close to our facility, close to the bus station. So there does hopefully addresses some of those access issues, leaves Brownsville open for partners who can operate testing as well. I know Community Health's operating down there today. And then we're working on having them out at Marie Young Community Center in Wedgewood on Tuesdays as well. So.
And Jeff, I like the Marie Young because it connects your district, Stevens district, and my district. So it gives access from the north end and the west end and in the central.
So yeah, and anything you guys can do to help drive the demand out there, I may not be a problem. I do know since that's a new location, we want to make sure that it gets utilized so that they can continue to go there.
So are we doing anything with Get Tested campaign? I know they're doing it in Leon County and other counties. What are we doing on our marketing and Get Tested campaign? Is there any resources going there? Or is that something that we need to partner with the county with?
That might be worthwhile, is having some kind of partnered campaign for that. We have
many billboards as I was traveling with youth sports over the holidays. So.
No, we can definitely do that.
Yeah, I haven't seen a lot of billboards or a lot of here in Escambia County.
Right now the demand's a little higher than what our testing capability is, so I think the campaign right now is working, so people want to get tested. So, but anyway, we can do that.
Right, no, and the demand is kind of high,
Yes, sir.
but there are certain targeted populations that are certainly not getting tested.
We can do that.
And so I think that, it has to be targeted in terms of those who may not have access. Marie said something today, they have to have an iPhone.
Right.
Well, so many people that I represent don't have iPhones. And so, I mean, we do need to get those billboards in neighborhoods.
Right.
Because I guess another question, Marie, would be, to me, with the testing kits, with the Medicaid expansion, are they paying for the kits or testing? I mean, those who receive assistance through Medicaid, I mean, this could be billed off to Medicaid, correct?
the take-home kits are,
No cost.
they're handed out. There's no billing,
Right.
or anything related
So we
to
just
that.
need to do a better job of access to vulnerable populations with the kit.
So it's just getting them to people and making them easy to use. I've got my staff trying to work on some instruction sheets that kind of help with the navigating the system, the process, because it's, to me, not very straightforward.
Okay. But I'm sorry, Jeff.
No, you're right.
The Medicaid expansion did allow for Medicaid to pay for vaccinations and boosters and those type of things, correct? If not for the kids.
The vaccinations, again, are no cost to anybody.
Commissioner Barry, you recognized.
Thank you, Mr. Chairman. Murray, what do you know about the way that our partners locally are handling their vaccination issues? Whether it be, I presume CVS, Walgreens are still doing vaccinations. Publix, is Publix still getting state allocations and stuff?
As far as I know, all the pharmacies are still receiving and providing vaccination. And typically what they do is if somebody has insurance, they will bill insurance and administration fee. but no cost out of pocket to the recipient of the vaccine. If the person doesn't have any type of insurance, then there is, I believe, a fund that they can bill for administration, but again, no cost to the recipient. At the health department, we don't do any type of billing.
Right. But they're still getting, I mean, all those private partners, they're still getting help from the federal government through the state, right? For that service? Okay. So is it your assumption that, I mean, they're all taking basically walk-in vaccinations?
That I couldn't tell you if they're taking walk-ins. I imagine the pharmacies probably are. They have been in the past. I haven't, I don't know if you've talked to anybody at the pharmacies lately
All right.
about their walk-in process.
But they're supposed to have some slots available for walk-ins, so.
So the issue that I was personally familiar with over the holidays was at one of our private partners. I just happened to be there standing in proximity to an elderly lady who was told that since she didn't have an appointment, she couldn't get a vaccination that day, that she could make a new appointment for the next day or the day after that. And she informed them that she was, at the location through transportation from her home in one of the homes on University Parkway, and that she wouldn't be able to come back the next day. And given the amount of public aid that those partners are receiving, that was tremendously upsetting, and it was, remedied after some time. But that was very troubling. I mean, it was,
Yeah, I agree. That is troubling.
I mean, that's the demographic, and you have somebody that's proactively. I mean, she had nothing else in her cart or in her hand. It appeared as if she only made the commute to get vaccinated, and those are, I would presume, some of the most vulnerable demographic. And to be told that she could make an appointment the next day or the day after that, that's, as somebody that I mean, we've received public, federal money through the state government as well, and the thought of us doing that is inconceivable, and I can't believe our private partners would be doing that as well. It's very troubling. Can you, as the lead medical official in Escambia County, can you proactively have some communications with our partners that I don't expect? I'm sure my colleagues agree with me, but I mean, we don't expect our constituents to walk in and be told that since they don't have an appointment, they're going to have to come back the next day. They're all getting a lot of help to try to do a public service. They're not eating the cost. I mean, who knows the private side of the revenue side of this for them? I mean, but I'm sure they're not eating it regardless. So, do you mind passing that on and communicating with someone in some leadership positions that that's not the feedback that I don't think any of us want to hear from our constituents, and it's certainly not the conversations that we want to hear, personally standing there.
No, I couldn't agree more with that.
Marie, I'd like to ask you a question that I think is on the mind of a lot of people who work in small offices or supervise employees. The guidance, now that we're in this Omicron surge, has been all over the place. We hear one thing from the state, we hear a different thing from the federal government. The CDC, they seem to be changing their minds frequently. My concern, and so please, what is the current guidance for a small business here in Escambia County if an employee is positive for Omicron? What is the current guidance, please?
That's a really good question.
It shouldn't be.
So, and yeah, there has been a lot of kind of flux in the guidance on this.
Yes, ma'am.
So the most recent guidance from the CDC, somebody who is positive should stay home for 5 days.
5 days. And then at the end of the 5-day period, initially, my understanding in reading various news sites is initially they said you don't need to test at the end of 5 days, you just come back and wear the mask for 5 days. But lo and behold, come to find out, they said that because they knew that there was a shortage of testing kits, as Commissioner May alluded to. And now, 24 hours, they walked that back. So at the end of the 5 days, according to the latest, do we have to test before we let them come back, or is that not required?
That is still not required.
Are we sure about that?
No, things can change quickly.
Okay.
I have not heard a requirement. I've heard that that was going to be revisited, and it was still left as a non-requirement, or this is all guidance, of course.
Yes, ma'am.
So somebody could test if they wanted to.
I think the problem and the fear, there's a lot of misinformation, and I think looking back at the beginning of the pandemic, when initially we were told, no, you don't need to wear a mask. In fact, it doesn't work. In fact, it's probably not a good idea. And then come to find out, lo and behold, we find out that was because folks at the federal level were stockpiling the masks and didn't want to run on the store, for lack of a better term. And then a month later, of course, ever since then, we got to wear the mask. So this time around, another example of how people think that there's politics and other agendas being injected when you tell us after 5 days, you don't need to get a test, but then come to find out, a lot of doctors disagree with that, and they believe you do need to get a test, and then, come to find out, it's because everyone knows there is no test kits available, even if you're going to buy them for $35 at Walgreens. Any thoughts on that? I mean, I think what we need is clear direction and clear guidance, especially for the small businesses. We start sending people home because they think someone, might have been exposed to someone, and there's no real clear guidance. The whole thing is going to come crashing down. So, I know that's a heavy question, but I'm hoping that you have the answer.
Well, an exposure is not the same as being positive.
So if I'm exposed to someone who has COVID, what is the new protocol? Is it 15 minutes within 6 feet? I mean, there's so many different things that have been put out there, and frankly, many of them have been found to not even be true. I mean, all the people getting the vaccines are now, the breakthroughs are going through the roof. By the way, that was a question no one asked. I didn't see it on your charts. Are we tracking the number? I've had 3 shots now. Are we tracking the number of people who've had the shots and are having breakthrough infections with this? I'd like to know that, because I'm the guy who did what everyone told me to do, and I got the shots. Now, I haven't had an infection so far as I know, but are we keeping track on, and also to disaggregate that, are we keeping track on those who had Johnson & Johnson, Moderna, or Pfizer, and then the breakthroughs? Is anyone anywhere keeping track of that? As I think people would like to know that.
I'm going to make a note. I can probably see about what I can do to find out about breakthrough information. I'm not sure if they're tracking specifics on the brand and breakthrough, but I will.
And my final question is, we've heard a lot about these pills, and doctors have, great confidence that these are going to be, they're very optimistic. Are we getting any of the Merck or the Pfizer COVID pills in Escambia County that we can distribute?
Not that I'm aware of at this time, and I know we both specifically asked this question, is it Monday or yesterday? I'm not sure.
It was yesterday on the state.
And the state has a very limited supply coming in, from what I understand. And so if and when we hear about supplies coming into Escambia County, then we'll have that information to share.
I appreciate that. Thank you for those answers. And if you could send, and I want to publicly say this, Maria has always been very good about sending I ask her difficult questions, and she follows up and sends me the answers, and I've always appreciated that. If those answers are available, I'd love to have it, and I think there's a lot of people who would like to know it, so I appreciate that.
No,
Yeah.
thanks, Mr. Chairman.
Yeah.
And I echo what you say, Marie. It's unfortunate we're back here again. It was such a pleasure working with you, but I was not, I was not upset that you were absent from the last couple of meetings when we were not in this situation, but unfortunately we are. But for misinformation or correct information, in terms of, being asymptomatic, sitting out for 5 days, after 5 days, will the home kit detect if I have it? I mean, they say wait 24 hours, wait 48 hours before you get tested and decide. So if someone is in a home with someone, and will it show up after 24, 48, or 5 days? I mean, when can the test kit identify someone that's asymptomatic?
The test kits that we have at this point, the not validation, but the effectiveness of detecting it is really for symptomatic people. That's an Abbott test kit. That's how they've evaluated it.
And the only reason I asked Maria, because I was with a health official who I will go unnamed, who's very close, at the heart of this, and says after 5 days, if you're asymptomatic, the home kits will detect if you have COVID. And I want to clear that up because that's what I've been saying. Is that accurate?
I couldn't tell you if that's accurate or not for the kits that we have.
Would you verify it for me?
I can see what I can find out as well on that. And just to kind of reinforce this kind of situation, this is still a very new virus. It typically variates, as we've seen. And so we're still learning as we go. And so that's why there's a whole lot of confusion.
What kit do you have, Marie?
It's the Abbott Binax Now. And it's an individual kit that requires a proctoring. So that's where the online application type situation comes in.
Right.
That you go online and somebody watches you collect your sample, checks your ID to, match the results to the person.
Okay. That's kind of creepy. Yeah, it is creepy, man. Yeah. Big Brother's in your house.
Wait, I gotta ask a question. Don't they have one where you, because I took one, you take it and you set it down, you do it yourself, and there's a strip, it's almost like a pregnancy test, and then 15 minutes, bang, you know whether or not, you don't have those?
That's what this kit is.
But I didn't have to go online, I didn't have to give any information. I went to Walgreens and bought one with my HSA card, by the way, which you can use to purchase these when they used to have them. Are those not the ones you're giving out now? Because a lot of people, like Lumen says, may not necessarily have access to the internet, or more importantly, may not have any inclination to want to
got a
share their
broadband
information
problem.
online. So,
Right. And that's one of the reasons why we, have our testing in the health department and have brought in the contractor, because we recognized that this is something that may not work well for everybody. But they were given to us. We like to, share them.
But you guys, just for clarification, that's a great question, Lumen. Your office doesn't have the ones that I can do self-contained without the internet, with Lumen's track phone, no iPhone, I can do on my own.
I like
without
that track phone.
Right. So do you not have those kits?
I mean, those kits are self-contained. It's just for validation and reporting purposes, like if you needed to.
Oh, an excuse for your job or something?
Yeah.
Okay, so you're going to get the result right there. You don't have to wait.
You will
for
get the
someone.
result right there.
I misunderstood.
It probably is the same little card that looks, you put the little swab in there and.
So you
the
don't have
lines
to, you don't
appear.
have to go online and do any of that. You could just do the test and not do anything, or do you have to go online?
Well, yeah. I mean, yes and no, I guess.
If you took the box and went home with it and you go online, you could still run the test.
Okay, that's all I
I'm
need
just
to know.
gonna tell you right now.
All I need to know.
But obviously, Maria, it's fair to say from this meeting that I'm hearing from you, we don't have ample test kit supply right now. Or do we have ample test kit supply?
For general community testing, we're hearing a lot of people wanting testing. And that's why we're trying to stand up, the testing operation that's starting today.
So the state's coming in with testing today.
So that should be opening today. Like I said, the press release is in my inbox for review, and I did see them setting up in the parking lot. So it wouldn't surprise me if they're actually open right now as a soft opening, because if they're ready to go, they'll take people.
So the state's setting up, kind of piggybacking on what Jeff said, the state's setting up testing today, right? For those people who may not have the access to the iPhones and those type of things. So the reason I ask, are there an ample amount of supply kits, is because people are complaining that they have family members in their house, and as you said, it doesn't go asymptomatic, but there's enough data, in my opinion, to suggest, and I don't know about this Abbott, but I can only listen to the professionals that I know, that after 5 days it would show up if you had a test kit in your home. So you could stay there for 5 days, and before you came out, if you had a kit in your home, you could test yourself before you get back in the general population. Seems to me that that's reasonable for people to ask if we have ample amount of supply. And I guess, that's question A, do we have ample amount of supply? And question B is kind of where Commissioner McGosh was. If we're testing positive or negative in our homes and home kits, how are we tracking that to give out that data that we need?
That's the key. And that's what we want. So the validation of the kit. For you to go home, that's how we get the data, and that's why you have the proctor.
That's
So
why
the
the
data comes
online.
back, to know what the positivity rate is.
But Eric, you could easily defeat that. I mean, I'm not saying people would, but my buddy takes it and then I just go on and it's me. You see what I'm saying?
No, I get that. So
When you say proctor, I think someone's watching me.
In that situation, it is.
Okay, so explain how that works. That sounds really creepy to me.
Go ahead.
So when I'm taking the test, I have to have a camera on my phone? Explain.
You basically would have to have some type of, and I started this process just to kind of see how it worked, and I didn't go all the way through because that actually would involve wasting a test. So there's a QR code on the top of the box that you scan. It takes you to an app that you download. You set up an account with your information. And then,
And I'm sorry to stop you. What if you have Lumen's track phone? How do you do it?
Right. And so again, that's why we have appointments at the health department and have asked the state contractor to come in and offer the drive-through testing.
So you have to be a pretty sophisticated individual and have, the technology to do this at home. Otherwise, you're stuck. You're at the mercy of doing, okay, all right.
All right. Well, then the app directs you to a website that you log in and you connect the account to the website. And then there's an option or the button that you click that you're ready to be proctored. And that's kind of where I stopped, but that it would bring up an online proctor. And so I presume it's a camera-based proctoring where it told you on the app or told me on the website, one of the two, that I had to have an ID ready, I had to have the test in hand, but not to break the seal on the test kit until the proctor's online. So my presumption is the proctor's going to check your ID, they're going to watch you open the test kit, watch you take the sample, and run the test.
So
It is unbelievable. But Marie, it's above your pay grade, and I mean, I know you have the Surgeon General and the great guy in Tallahassee. But even on the state website, it says, who is the test recommended for the home kids, ages 15 to 2, and it can detect it whether you're asymptomatic or not. I mean, that's on the state's website for COVID. So I would just like to, I'm happy to share that with you later.
That would be great.
And I know this discussion's running along, but it's rather fascinating.
Well, it's important. I mean, we hadn't had time
very
to talk about it. I mean, we all represent a lot of people.
Yeah,
and I
absolutely.
represent a lot of people that don't have access. There's not marketing to them. They don't have iPhones.
Exactly.
They don't have transportation, and they can't get a home kit. Well, we got a bunch of money in this county. If the state's
find a
not
way to
doing
give it
it,
to 'em.
we're going to do it if the state doesn't do it.
Yeah,
in my
absolutely.
opinion. I mean, that's what the money was spent for, to fight COVID, and whether it's recovery or rescue. That's why I want to ask these questions just publicly, because I'm going to ask our administrator to do more. I mean, our coaches can't coach, our children can't play, sports are being jeopardized, events are being canceled. I mean, some of our larger events are being canceled because of this, so we got to be very proactive. So that's my reason, Marie, not to drill, but to ask the questions, because I want to know. I mean, session's in next week.
That's right. And of course, Lumen, when you bring those initiatives, of course, you'll certainly find my support, because whatever we could do to get the kits to people so people know, because then the uncertainty of not knowing, and it just cascades.
And Jeff, can I say something when you said, before you say that?
Yep.
Eric, all I'm saying is if the state won't do it, and if we have proven data that they work, we buy our own, and bring that forward. I mean, we can't sit, that's above Marie's pay grade. I mean, if they work, if we have scientific data that says that they work and people are in their homes and they can't get kits, we should buy them and put them in the homes of the people. I'm sorry, Jeff.
No, you're good. You're perfect. I know. It's hard to get out of these discussions under an hour, but there is a lot of, I just have somebody I could sit here for hours. But Eric, two things for you. The dashboard's back up and running. That's helpful. That's great. I don't see the recoveries and I don't see the ventilators. I think those are important data points. Is there some reason why they're not included?
No, it was just, the dashboard is what we had here in the Delta, so we just brought back what was in the Delta. We can add those pieces back, that's no problem.
I'd like to know the number of ventilators being used, because it's, of course, anecdotally, we're hearing that, the Omicron, even if you get sick, is a lot less serious, I guess, for lack of a better word. And then the question for you, Marie, on this, just stepping back from our local community, but just the country as a whole, I'm looking and reading about what other countries are doing now that Omicron is blowing through: South Africa, England, Denmark, places like that. And it appears that it's, because it's so transmissible, that there's a component of it that could be I hate to use the word helpful, but helpful in terms of folks getting the herd immunity that Lumen mentioned earlier. And a lot of them, Denmark in particular, is saying that they believe this is the harbinger of the end of the pandemic, because it's just running through so many people and giving them natural immunity that apparently, according to a study that I heard about yesterday, is 13 times more potent than the vaccines. Are we at the precipice of the end of this pandemic because of Omicron, in your opinion?
That's, yeah.
Yeah?
No, not yes to
No.
answer your question. Yeah, that it's a kind of a difficult. So again, novel pandemic, novel virus. We will know more when we know more. And this is kind of one of those time will tell situations. From an epidemiological history standpoint, that's probably not outside the realm of possibilities.
And then finally, a rhetorical question. Do we still believe that it was a bat that flew 800 miles away to the pangolin and infected the wolf puppy? Or is it established that it was the bioweapons lab around the corner? Rhetorical question. Anyone else?
No, Marie, my dear friend did tell me that it's not on the state website, it's on Abbott. I apologize, but Abbott says that it's detected in anyone after 5 days. So if you just look back at Abbott versus the state.
Okay,
Thank you very much for your time. Thanks, Eric.
thank you.
Eric, a couple questions for you.
Oh, go.
So how are we doing with testing in the jail?
So right now.
And what are our positives and what are our protocols?
I don't know that rate. Chief Powell, I'm gonna have him come and talk about that, but he has Abbott Binax now that he's utilizing in the jail. So he has some, I don't know what his stock is. I did help him, we give you, 320 test kits yesterday, so we're trying to keep him stocked so he can do his testing in the jail. I don't know what his positivity rate is though, so.
So you say so community health is chief giving analyzers and they provide test kits as well, correct? So how many test kits do we have on hand and how many have we used?
I don't have the exact number, I have the number of how many we've tested since the beginning of this entire onset. Just give me a moment, please.
I mean, you don't have to do that. I mean, you can bring it tonight. I mean, I'm curious, how many people have we tested? I mean, what's our stockpile and how are we utilizing analyzers? Because I would have to think that the jail has a higher risk than anywhere else in our testing protocol. And if we have tests or we need more tests, if it was my opinion, Chief, you know it, I know you said it's logistically impossible, I'd be testing everybody that came into jail. I think that that's important. I think we should. I want to be on the record for saying that. If we don't. Some things I don't have the power to control, only to sit here and, sing a song about. But I think that, if we have people in jail, even if they're asymptomatic, those people are staying an average of however many days, 7 to 14 days, are going back in our population, and they're spreading it. I mean, I think it's responsible. I mean, it would be very good stewardship for us to be testing people that come into jail if we have the supplies. And so, how many positives do you have on hand right now,
As
Chief?
of yesterday afternoon, we had 8.
8. And how are we deciding who gets tested?
It's all based off symptoms. Somebody's symptomatic, and then we formed the same process we've been doing since March of last year. When somebody's positive, we quarantine that unit for a period of 14 days to observe them closer and monitor for any symptoms. Anybody who then shows symptoms, then we manage them medically. Just the same way we've been doing since March.
And I'm sensitive, Chief, to the staffing shortage and issues that you have in the jail. But if the kits are free and we have them, and it means we just got to get a little extra personnel and maybe not your people, partnerships with community health, our public safety to get people. I think people, when they come in the door, should get tested.
And the vaccines are going well as well. We're seeing more and more request them, and we administer them twice a week at the jail.
And I appreciate it. And Chief, it is for the inmates because I believe, we represent not only inmates, but more importantly, for the anxiety and for staff. I mean, we're asking staff to be in a confined place, and even in the old jail with not very good ventilation, we're asking them to, come to work and risk their lives. I mean, I want to support you in giving them the safest environment I can give. And so to me, if I worked in the jail as a CO, as a custodial, as a cook, I'd want everybody tested that came into that jail for me.
We had yesterday, our number was 15, 15 staff are out.
So we got 15 staff out. And to me, that lends itself, Jeff, more to why we should be testing when people come into jail. Because we got 15 people out, and I can assure you that there are some anxieties and fears for many of your staff who probably can't vocalize it, to their superior for whatever reason. But there are concerns, and I'm concerned. And I think that we should, Eric, I think it's the public safety's responsibility to get with the corrections to provide for the public safety of citizens. That's our job. That's the number one priority.
Went without. We've always
Yeah.
been working ahead of inventory.
They've always had inventory this entire time, so.
Well, we ought to be testing more people then.
Okay.
Yeah.
Yes, sir.
Thanks.
All right, thank you, gentlemen. And we're going to move forward now with speed at pace. So number 5, recommendation concerning a corrected retirement proclamation. I'm going to look for lights. Lumen?
No, I'm sorry.
It's all right. Number 6, recommendation concerning West Florida Public Library Board of Governance appointees. There's 2 of them up. Number 7, recommendation concerning amendment number 1 to the Pensacola Perdido Bay Estuary Program.
Hey, Jeff?
Yes.
On that, was it the library?
Yes.
Just, why the difference between starting now or starting in 2 months?
Yeah, Todd, you want to come forward and explain? I was
preference on
wondering
that?
that too.
Yeah.
Why is there an A and B? Why can't there just be an A?
Our last few meetings, we've not been able to meet quorum because the mayoral appointee is not present either.
Okay.
So that's why I would hope that we could start one sooner to make sure that we can have a meeting this month.
So you have to have it this way, A and B.
We don't absolutely have to. The mayor's office did send a name to me. I haven't seen that they've officially accepted.
But we can go ahead and name both of them. Yeah. Or, so you're looking to fill one spot?
If I have one spot, we would have met quorum the last
No.
3 meetings.
You're saying to a point, you're saying that you have one spot to fill between these 2 people, even though there's an A and a B,
We
right?
have to pick.
One immediate spot.
You have 2 spots
I
open?
have 2 spots. One expires the end of February. So I mean, we're actually filling that earlier than we need.
So is somebody in that spot right now?
Yes, one person,
And that's
Dr.
not one
Bryant
of the,
is,
that's not one of the 2 that are here. So we need one person that has an immediate opening, and then we'll have another one when that term expires.
right, that person wouldn't start until the March meeting.
Okay.
And then,
So let's
last 3 meetings we had to cancel because we couldn't meet a quorum.
It sounds like we want to do A with one of these people, and then we'll see probably one of the names and somebody else in 2 months.
Let's go ahead and do both of them.
Yeah, and that's what I thought too, man.
Well,
One of them just effective in a month.
what about the person who's in there now do you want to see if he wants to
I'm
reapply?
going to assume they haven't, that they're going to.
She's already done 2 terms, Dr. Bryant,
Okay.
Dr. Laura Bryant, she's done 2 terms, and she has to stay off 2 years before she could reapply.
Okay, so we'll just do both, okay.
All right, so yeah, we'll probably do both of them tonight.
Okay,
Thanks,
thank
Todd.
you.
All right, number 7.
Todd, I'm sorry, do you have a preference?
No,
Don't put them
no,
on the
the
spot
only
already.
reason the applications
on the
come to
board.
us is we make sure they haven't been trespassed from our buildings.
Yeah.
And then I just forward them over. I do make no evaluations.
Have
That's-
either of them been on the board already? Or
No.
neither of these candidates are currently on your board? I guess I was kind of referencing if one was already on the board, but.
Then you want to do
okay.
it early.
Yeah, neither one are on the board currently.
No, neither one are on the board, and I have no personal knowledge about either
So
candidate.
you like both of them, huh, Todd?
Well, it's our 2 applicants. They seem to be both good on paper.
You
so-
sound like a politician up there. Very good.
Well, they're good on paper.
I wish I had 5 candidates, and you guys could have more to mull over, but
Great
it's taken
answers.
us quite a while to get the 2.
Well, very good. We appreciate it. We're going to have we'll have a nice
Exciting.
motion and second tonight for that. Okay, number 7, estuary program. Any questions on that? There's been some conversations. All right. Number 2, car budget finance consent agenda. Number 1, recommendation concerning residential rehab grant program funding and lien agreements. Lumen?
No, I will have a comment tonight
Okay,
about
hit
that.
your light.
About the estuary, I will have comments tonight.
Tonight, okay. You want me to hold it? Yeah. Okay, so hold number 7 for comments from Commissioner May tonight. All right, number 2, recommendation concerning residential roof program. Okay. CAR 2-3, recommendation concerning supplemental budget amendment resolution number 22 SBA-20 for PD 20-21.068, Lee Street sidewalks, drainage and sanitary sewer project. Number 4, recommendation concerning interlocal agreement with Town of Century for the SHIP housing. Number 5, recommendation concerning supplemental budget amendment number 22 SBA 21, Clara Long. Number 6, recommendation concerning defense infrastructure grant agreement number S0172 in the amount of $300,000. Number 7, recommendation concerning a contract agreement with Gulf Marine Construction for Lafitte Cove Canal dredging project in Commissioner Bender's district.
Mr. Chairman?
Yes.
It references in the backup in the narrative that there were 2 bids, but it doesn't include the bid tab sheet.
Which one are we talking about?
Item 7.
7? Okay.
Yeah. So can we get that sometime during the day today?
Yeah, Wes, can you take that? You'll email that to us?
Absolutely.
Okay, all right. Anything else, Stephen? All right. Moving on to number 8. Recommendation concerning the issuance of a purchase order over $25,000 to Blue Arbor for Department of Natural Resources Management. Number 9, recommendation concerning the issuance of a change order for the Blue Arbor Incorporated temporary services in excess of 25 grand. Rebecca McMullen. Number 10, recommendation concerning supplemental budget amendment 22-SBA-27. Rebecca McMullen. Number 11, recommendation concerning supplemental budget amendment 22-SBA-24. David Stafford.
Hey, Jeff, on 10?
Yep.
I just want to say, I'm glad we were able to get this done. I think it's a great thing for our hospitals.
Absolutely.
It's their money, and so it's going to be able to bring quite a bit back for our area community.
Yeah, absolutely. Do you want to hold that for any reason, or?
Nope.
Okay, all right, just, very good. All right, no questions on 11. We'll move to 12. Recommendation concerning the issuance of a fiscal year 2021-2022 purchase order in excess of 25 grand to PC Specialists DBA Technology Integration Group for the Cisco SmartNet renewal.
Mr. Chairman?
Yes, Commissioner Berry.
Yeah, I've got some questions about this.
All right. Bart, you want to come forward, please?
Yeah.
Do you need Bart?
Yeah, I suppose, yeah. Good morning, buddy.
Good morning.
Hey, so, all right, PC Specialist is the vendor. The quote and the way the contract, the state contract that we're using,
Yes, sir.
are they the party on the contract, or is the contract simply the terms related, the terms directly with Cisco?
So Cisco is the company, and then
Right.
they can't sell direct. So they have to go through a reseller, which is TIG, is our reseller. What TIG does is go out and look for us on, state contracts, cooperative agreements, and gets the best deal at the lowest, cheapest rate. And so through this one, the NASPO, that contract that's referenced there, the WSA 14 ACS, was the cheapest rate that we could get through Cisco.
All right, so is the way that Cisco does contracting and licensing, is TIG like their franchised representative here with us, or are there other Cisco representatives
So
locally?
there's tons all over the United States. And so what we found, though, over the last 2 or 3 years in dealing with all the vendors, what ends up happening is once they get an initial vendor, I'll say, what they do is I'm going to use the word preferred, but that is the vendor that's already got the best deal. So you're ending up, even if we go out, because normally what we do is we'll send it out to there's 3 vendors that are out there that do state contracts, and they'll all come back with a price. TIG is usually, because we've been dealing with them for the last, I think, 5 or 6 years, is the best deal on all of them. And then we do require, just so you know, for TIG, we ask them to go out and show us, hey, what did you get from all the different cooperative agreements that are out there, and plus the state contract, and we're always cheaper than the state contract, and then they give us the best deal of whichever cooperative agreement's out there.
All right. Can you send the responses that we got from them that include the other cooperative purchasing agreements, because that's not in the backup.
Okay, all right, we can do that.
Just where it shows, the rationale for why we're utilizing this contract versus,
Okay.
versus another contract. And is there something memorializing the use of TIG in this instance, as opposed to the other 2 vendors again?
No, sir, we don't, again, what I've been told by both the purchasing directors beforehand is a cooperative agreement is, the board has approved us using cooperative agreements, so we've been using those.
Yeah, I mean, and the board, and, we don't have an issue with the cooperative agreement aspect, but even using the cooperative agreement, there needs to be some type of narrative or rationale that it says, this is why this is why this is the best, because there are multiple cooperative agreements out there. This is why this is the one that we're going to utilize for this purchase. If we're not doing, a strict low bid, a formal low bid invitation, there needs to be some narrative other than just the legal aspect of saying we can buy off this contract, which we can. That's not disputed. But all right, and Mr. Chairman, that does move forward into the next one.
Okay.
So it's another one to Shy International. It's the same thing. I say the same thing. A similar thing. We're buying off a contract, and okay, I guess this is a little bit different. I mean, a lot of us, even lay people, are familiar with Cisco stuff. What is this one, this Varonis?
What is Varonis?
Yeah, and it seems as if we have a lot of these type things, but I guess what exactly is this?
So Varonis is a product, and in the description, it tells you exactly what it is, but it's, in a layman's terms.
Tells you what it is. It doesn't
Yeah,
tell me
so
what
in a
it is.
layman's terms, yes, sir, what it does is, let's put it like this. We have a ton, 13 terabytes of data on all of our servers. We have a lot of PII data. We have a lot of HIPAA data that's out there. We don't know who all has access to it and who should have access to it. That's the first thing. So
But you should know that. What do you mean you don't know who has access to it and who should? That's a pretty defined statutory thing, right? I mean, Allison, talking about HIPAA
Well,
stuff
let me give you,
and
for
things.
instance, Commissioner Barry, when there are some people that think that they have to have your social security number and driver's license to do certain things, we have no idea who is requesting that information from individuals, employees that we have. They'll get that data, scan it in, and put it on a shared drive or on their personal drive that we have no idea they've done that because it's not something we've been prefaced to. So what we're trying to do with this product, what it does is go out there and searches for all that PII data, all that HIPAA data, tells us who has access to it, where it is, and then allows us to then start getting with those departments and try and figure out, okay, hey, number one, should everybody have access to this?
Isn't this sounds like a legal thing more than an IT thing. I mean, isn't this something that should work through your office about who's got what access to what data? I mean, I'm going to
We do that daily. I mean, so daily, when we hire a new employee, one of the first things we do is say, what access do they need? What are they going to get to? We've never ran, I mean, we can start running it through the attorney's office if you'd like, but I think they get overwhelmed with what access do they need, everything. So what we normally do is talk to, let's say somebody was hired into IT and they said they needed access to go into Eric Gilmore's shared drive. We would probably say, we'd ask that question to Eric, do you want to allow them to get access to that? If he said yes, then we would. If he said no, they wouldn't get access.
I mean, as a layperson, I mean, the access to information sounds like it's something that needs to be coming from the top down somewhere, from administrator or from the attorney's office, rather than the internal policy being set by IT as far as who has access to what. Wes or Allison, I mean, as the board's two employees, it seems like we have had issues with employees complaining about who's got access to what of their data. That's happened, a couple of times in the past. It seems, I mean, the policies for who has access to what and who needs access to what needs to come from, unless my peers disagree, I mean, it feels like it needs to come from the board through one of y'all's office saying who needs what, not an internal policy being set by the IT department.
That seems reasonable to me as well.
Yeah, I can understand your concern. I think what Bart is saying is that there is information on that maybe we don't know who has that information.
What I would tell you over the however long the county's been here and had an IT department, people that set things up over the years set it up incorrectly. We have data that is out there that is available for everybody in this county to see that is HIPAA data and PII data that they should not have access to. And they do today.
And we're just now figuring this out.
I've only been here 2 years, and this product, if I had a person trying to do this, it would take them just full-time 2 years probably to do. You buy a product like this that they ran, we did a proof of concept with them, and within a month's time, we got the report that's attached, the risk assessment, with all the issues that they found. So what this product will do will allow us to start addressing all of those issues immediately and solve a lot of the issues that we currently have today.
Bart, and obviously we have a lot of responsibility, no authority. If we have people's HIPAA information that's been out for years, and we've had an ID department, is that true, Wes?
Commissioner, I'm unaware. All I can do is go by what Bart is, the facts are what they are as stated. So I think certainly there's two things. We can certainly address who has access to what. I believe what this software is doing is scanning the system for some of this data that we don't know is in certain places and alerting us so we can go address it. I believe that's correct.
And Bart, I mean, Wes, I'm good, but I tell you, every time we have change of directors, change of administration, we come in with hundreds of thousands of dollars of supposedly new technology. I don't care, whether it's building inspections, I don't care whether it's human resources, payroll, that's all we do. And, And then if we change administration, 2 years from now, people say, well, that was screwed up too. I mean, we continue to pay for it. I mean, we bought this PA system and for this DIS 3 times. Every time we get new PIO people, the other one was horrible.
Right. I understand.
And so, I mean, that's why it needs to be a good analysis. I mean, that's what we do.
The HR software from a year and a half ago? Or
HR software, I mean, PIO cameras, the whole 9 yards. I mean, and we get stuck with great editorials about us because it's like it's our responsibility.
Cartoons, too.
Yeah, and we have really no insight other than to come here and someone says to us, well, it's been done wrong, which I have a problem if Bart's saying it's been done wrong, and I've sat on this dais, for 2 terms, and, even your HIPAA information has been accessible. So somebody had been working here. The whole staff ain't changed in IT. I mean, just like in all these departments. I mean, we love to blame the director and the administrator, but I mean, it trickles down.
Sure,
So-
absolutely.
Okay, just a couple of things there, Commissioner May, is almost the entire staff has been replaced. We've got 25 employees. 21 of the 25 have either left on their own or found new jobs for more pay, or we helped them.
Well, let me ask this, Bart.
Yes, sir.
So when you're saying people have access to information, have we ever had a breach of any information being leaked out to anyone's knowledge?
Not that I know of as of yet.
So, okay.
But what I will tell you, and one of the reasons, one of the other things this product is also helps with that threat protection and ransomware attacks. So what it does it looks up using machine learning. So if it knows that I normally work 8 to 5 or 7 to 4 or whatever I'm normally here, if all of a sudden it sees my ID doing something at 1 o'clock in the morning, it's going to alert us and say, hey, you need to check and see what's going on here because this is abnormal. Because what could have happened at that point is a hacker could have got my ID and password and is now trying to do stuff that we don't want them doing. So that's what this product will do. That's another advantage. The other thing is insider threats. So the world that we live in today is totally different than 3-5 years ago. The number of attacks that we get hit with, right now there's an attack, I think I sent all of you all that email about Log4j. Thousands of companies are getting hit with that ransomware attack right now. We have, over the last 7 days, we've had 300,000 attempts to look at our network for that Log4j to see if it's a vulnerability. So the things, you're correct, we are spending more money on security than we've ever done. Every company in the world is doing that right now. Because if we don't, we will be the next one to get hacked. And then if we don't have tools like this that give us that information to know who has access to what, now they can get in, and because everybody has access to these folders, now they can get in there and see everybody's HIPAA data, Social Security data, which is why when the city got breached, they had to turn around and pay for everybody to have, I forget the product they ended up buying, but
Credit protection.
yeah, one of the credit bureau products.
Bart, let me ask you a quick question.
Yes, sir.
I have no problem with any of this. I appreciate what you're doing. I think the questions are valid, but I want to ask you this. How do you balance your need for security? You mentioned something about someone logging in at 1 o'clock and you get a notification. So if I take my laptop and I log in at 1 o'clock because I want to look at a chili recipe, do you know what I'm looking at? And if so, how do I balance privacy of users with your need to manage security?
So what I would tell you is, first of all, every employee, when they log in every day, there's a box that pops up and says you should have no reason of privacy because it's a business computer, not a personal computer.
Understood.
So that's first.
Understood.
So we would look at it. We would see what they're doing. Usually, if it's a hacker, they're trying to go places they shouldn't go.
Okay.
But
I appreciate you trying to answer
Yeah.
here. So at 1 o'clock in the morning, I wake up and I'm looking for a good recipe for super hot, spicy
Right.
chili, and I punch that into Google. Are you telling me right now?
No, sir.
What do you see that I'm doing?
So what we would do is we can see everything you do.
I have nothing to hide. I'm just
Right, no,
hypothetical.
but we don't do that. I mean, we're not actively looking at what you're searching on the internet.
What are the ramifications? Isn't there something like this was going on when Janice was here? And
No, that's a totally different
What was
product.
that?
That
What was
product, you could
iSpy.
actually, what's that?
No, go ahead.
Yeah. No, I mean,
go ahead.
I get what you're trying to do, but,
Yeah, that's
but
fine.
you're saying what that was before that kind of leaked out to the press, and we're not doing that.
Right.
Okay.
Even that product, so that product before would log information. So what you want to do is you want to make sure that people are doing the right things.
Okay.
So, because, I had a manager one time tell me, okay, why do I let people work from home versus here? And I said, well, walk down that aisle and tell me if they're working or not. And he goes, yeah, they're working because they're here. Well, just because somebody is in the office doesn't mean they're working.
Amen.
They could search the internet for 8 hours a day.
Absolutely.
Right now, today.
Many of them do.
Yeah, today we don't have a tool that could tell you that. That other tool would tell us they're actually doing work or they're actually surfing the internet all day, not doing work.
So
that-
we have an employee who,
But now, let me make sure, Commissioner Judge, I just want to make sure, this product does none of that. I mean, so
Okay.
right, it's a totally separate product. This product is on the back end, all right? So when we set up a new user in IT, when you come on board, we give you access to certain data.
Sure.
So like if you're in PIO, you're going to get the PIO shared data files. They don't get my data files. They don't get accountings.
Everything's compartmentalized.
Everything's compartmentalized.
Understand.
What I'm telling you is today, in years past, somebody set that up incorrectly and they put in a group called everyone, meaning everybody has access to that data in certain instances.
Yeah.
And so that's where this product will go out and search 13 terabytes of data on 350 servers that we have.
And figure out
And
who's-
put it on a dashboard for my team to be able to go through and say, we got to fix this file, we got to fix this folder, we got to fix this folder.
No, I have no
Instantly.
issue with that.
Yeah.
It's a difficult thing to balance what you need to do with the privacy.
Right.
And I get it, these are public computers, public
Right.
resources, but still, I mean, who would have access? Let me ask you this question a different way, because now we're onto a topic that
Mm-hmm.
piques my interest. So we have an employee who perhaps his job is estimating and he does market research. So he's in Google and he's
Mm-hmm.
looking up parts for a bus. Who in your department can go in and look at his Google search log, if anyone? And what would be the impetus for anyone to do such a thing?
So we wouldn't do that. Number one, we don't have that.
You
Because
don't.
again, we don't have that product. Now, we can, every PC tracks certain thing in your cookies and things
yeah,
like
but
that.
you would
We
have
could
to
see
come and
that.
look
But
at
this product would not, there are products on the market that when you went to Google and if you typed in,
Parts.
Scambia County or whatever, it would tell you exactly what you typed in the search bar. This product would not do that.
So can your department, if folks work remotely with laptops, can your department go in and say, okay, he's looking up, parts for this?
Not without them knowing.
Not
So,
without-
so we have BOMGAR, which is a product that if I need to help you when you're working wherever,
Yeah.
I can remote into your machine, but it pops up on your screen to say, hey, Bart Siders wants to remote into your machine. You give him permission, you say yes, and then both of us control the keyboard so we can work through
Right
it.
on, okay. Sorry, guys, thanks for indulging that conversation, but I remember that was a big topic of
Yeah,
interest
totally
online.
different product. The other thing, just so you know, when I mentioned insider threat, so the other thing that you want to do is anytime somebody's leaving a company or you got an employee that's just acting very irrational or things like that, what this product allows us to do is monitor insider threats. So you put them in a watch list, and if they start doing things that are very abnormal, it alerts us. Or if you got an employee that's leaving and all of a sudden they start copying
Downloading
every file or deleting the H drive. I mean, because they if they're still here, they have the ability to delete everything on your H drive. So you don't want anybody to be able to do that without us knowing. So what that does is it alerts us for it. So
Right, no, that's
those
good
are
stuff.
some of the benefits of this product. I mean, again, we've done it without it right now, but what I'm telling you is
This makes it better.
from me and from my team to be able to fix all these issues, we have to have this product. And I
Is
will
this
tell-
25 a year or just 25 one time?
No, this is actually, let me make sure I give you the right quote. It's 48 a year, and that is, I will tell you, when we first started, the price was about at 70 grand. And we kept beating them down, we kept negotiating, and I will tell you, this one is, because of the way we kept negotiating with them, if we don't sign, give them a PO by the end of next week, we won't get this price again. They gave us a year-end price, and that's one of the reasons why we also tried to lock them in on 3 years, because the other thing we're seeing right now for all IT equipment and software is we're seeing a 3 to 10% increase per year for all of the software that we're having to renew.
And this is a company that's located somewhere that just monitors this through the clouds?
Yes, sir. Yes, sir. And I will tell you, I mean, Varonis, if you look at every, Gartner, Forrester, every product out there, and anybody that evaluates products, this is the number one product on the market. And
So if an employee was on Facebook, Bart, this would
right.
alert you, or?
No, sir. No, we don't look at what people are doing on the internet.
So staff could be, right now, people sitting out there right now could be on their county device on Facebook posting about the commissioners, and
Well,
we would know.
They can't be on Facebook because we blocked Facebook.
Well,
So,
the other
but-
social media
But
sites
other
that they
social media,
use.
they
But
could.
Twitter,
yes,
yes,
sir.
okay.
Yeah,
Yes.
the other ones, yeah.
They could. Now.
Oh, yeah, he's probably on
If
it
we
right
had
now.
approved the
Yeah.
other product that went to the press and everything, we would know that.
Oh, this will go to the press. Don't worry about it, yeah.
Okay?
Anything
So,
else?
I mean, is there, so, and I'm looking at Todd. So we have products that monitors if someone's going on a porn site
Yes, sir.
or
Yes, sir.
Is that blocked in our
Yes, sir.
libraries and with our
Yes, sir.
staff? I mean, are there
Yeah.
certain sites that staff and
So-
library people can't go on?
Yes, sir. So we have Palo Alto firewalls all over the place, at all 40 sites where we have the community centers and parks and recs and all of those things, plus here within the county. I think it's about 48 total firewalls, and every one of them blocks porn. It blocks for people to be able to watch Netflix and, Roku and blah, 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 all those different social media sites. It's blocking all that unless, like, each of your teams are unblocked where you can get to it.
What you said, each of our team, what did you just say?
The district, so you and your admin and anybody in your office, so each office has requested that they have social media access. So you're able, so you and your admin can go into Facebook. Jeff can do the Facebook Live that he does. Excuse me,
You can
Commissioner
block
Burgash can do
mine.
that.
I don't need it.
Yeah.
I mean, I don't.
But most of them have requested that, so they're unblocked. And there's a handful, PIO, anybody, or CMR here, everybody there is, so they can tweet and Facebook and all that live.
Oh, no. I know some of them have access to it. I've read it. I have a file. Yeah.
Yeah, we read it too.
Yeah.
All right, anything else for Bart? All right, do you want me to,
I
Yeah,
don't know.
Mr. Chairman, yeah, I do.
do you want me to hold, which ones?
Steve, go ahead, Steve.
Not on this item, on the next one, so.
Okay, which is the net, you're talking 13 or 14?
15,
15, okay,
Yeah.
so
So-
we're good with Bart then?
yeah. This is still Barth.
I'm sorry.
So the one about Shy, the Splunk. I'm
Yes, sir.
sorry, this is 14, then I'm sorry. The one about Splunk, it says that we got 4 quotes for this process, for this product, so, or for this type of product. So what is this? What's this one?
So this is our security side of the house, 100% on the security. So we have the 48 firewalls that are out there. Every network device that's on the network all creates logs. Thousands of devices that create what people are trying to do, outside attackers coming in. What this product does is take all of that information, correlates it in, and then shows it to us on a dashboard so that we can see if somebody is trying to hack us, what are they doing? Like, for instance, the Log4j. We used Splunk the other day because we have a proof of concept going on with them to be able to
For
take...
who? I'm sorry.
Excuse me?
For who?
The Log4j that I was just telling you about, the virus that's out there, the ransomware attack that's hitting
Oh,
thousands.
okay. All right, I got you.
Okay. That product, we were able to use Splunk to tell us, is anybody trying to come in through the outside in there using any Log4j app within the county? It just, again, it's a product that will help us do our job better, faster, and protect the county. And one other thing, just commissioners, I just want to make sure y'all understand. So, like I told y'all way back when, my goal is I'm going to cut enough cost everywhere else in order to pay for the stuff that we need to do our job in the future. And so with all of these products, my budget will be at budget or below budget, even with buying these products, because we've cut a lot of other things. POTS lines that we were paying $390,000 before, the last 10, 20 years. We're now only going to pay probably going to get it down to about 150. So we're going to have saved all that money. So that's the money I'm trying to reuse to do these kind of products.
Yeah, I mean, I still just want to make sure,
Yeah.
our responsibility is just make sure that we're getting the best deal that we can on this
Understand.
stuff technically that none of us are probably equipped to.
Well,
Like
what I
argue
wish
with
Mr.
you
Underhill was
about.
on this, Commissioner Underhill was on this one, because I will tell you, like me, I would have never thought we could have afforded Splunk. It is the #1 SIM out there. And when we first started negotiating, we couldn't afford it. But we beat them up and beat them up and beat them up.
Yeah.
And all of these, both Splunk and Varonis, we dealt with. Shy was an intermediary, but we were actually dealing with VPs at Varonis and with Splunk to get that price point down.
Perhaps they'll be here this evening. So the Splunk part, so we got quotes back from 3 vendors. The Humio and Alien Vault, are those other are
Yes,
the
sir.
other?
Yeah, those are other products, other SIM products that are out there on the market, leading in the market. We try and look at the top quartile products.
Okay. So the multiple quotes are related to the actual software, not related to the vendor in this instance. If you had chosen Humio, then the vendor would still be Shy International.
More than likely, yes, sir, because Shy is the biggest software house, and that's their title, Software House Center, and they're the largest one in the country.
Okay. All right, and do they do the same thing you were referencing that the TIG group does? We're buying off this Sourcewell contract?
Yes, sir.
Are they comparing the
Yes, sir. Yeah,
Sourcewell
they-
contract with other contracts?
They go out and look at every cooperative agreement and then give us the best price.
All right, do you have some
Yes,
of that
sir, I've
other
got
data
those. I can get 'em.
that you can send? All right, and the next one is related to TIG again as well. So, all right, so what is this? Yes? For the COC?
The COC?
Yeah.
Yes, sir. So all the network gear, which is all of the switches, all of that equipment that connects all the PCs and the COC back to the network, is still the original equipment that was put in, 10, 12 years ago. It's not supported by Cisco. They don't get security updates. So it's just a vulnerability sitting on our network, plus it's starting to fail. So we want to get out. We have 2 more offices to do, the COC, and then later this year we'll do public safety. And at that point, every bit of our network gear in the county will be up to not using 10 and 12-year-old gear.
Okay, and did TIG do the same thing in this instance where they were using this NASPO contract, but they provided backup
Yes, sir.
that show references to the other state contracts or other, agency contracts? All right.
Bart, back up. How was this, you said the previous system will protect us so we won't be as vulnerable as the city. How was the city system breached?
So what the city had done is, one of their IT people, I believe, I don't know, I won't say because I don't know for who put it on there, but they put a device on the outside the firewall that had something called RDP, which is a remote desktop protocol on it, so that you can remote in and then get into the device. Well, it should have never been on the outside of the firewall. So that meant that since it was outside the firewall, anybody could see it. Where if it had been on our side of or their side of the firewall, it wouldn't have been sent. But they didn't give me all the details, but that's what I understood.
And that's what I was going to ask you. And I mean, listen, I don't even send out emails, so I'm not that technology savvy. But from what I understood, it was through their camera system, and someone did exactly what you said, set up a system outside of the firewall. So had they even had this system and they set something upside the firewall and through their camera system, they still would have been breached, correct?
Yes, sir. Oh,
So,
yeah. Yes, sir.
to the point that even if they had this system, and so there are some things that we could do that we could still be breached if someone
Yes, sir.
does something
100%.
like that.
We
So-
are one employee away from filling out. That's why we do the phishing alerts. If you give somebody, a hacker on the outside, your ID and password, they now have an end to our system.
Exactly.
And that's why we do all the phish alerts.
And all that I'm saying, Bart, I'm fine with, I'll support it, but to make the analogy of that, we won't end up like the city if we don't buy this product is not quite true.
I will say 100%. I will make no guarantee. It's not it's not if we get hacked, it's probably going to be it. When.
Right.
Because every company out there, I used to work for Southern Company, as you know, they spend
Absolutely.
millions and millions of dollars. And their security officer will tell you, we're trying to stay one step ahead, that he'll never guarantee that they won't get hacked.
No, that's fine, but I just wanted to make the point of buying this system.
Yeah.
And was not the reason, had the city had this system that
No,
we're about to
no,
buy,
no.
they still would have got breached.
And if I said that, I'm sorry. I did not
Previously, you
mean
said
that.
so we
Yeah.
won't end up like the city.
That
And,
is, now I
the
do
city
agree.
ended up like that.
It would have helped them to have
Right.
some of this equipment.
Right.
Because it would have gave them alerts ahead of time.
It would have, but it wouldn't have stopped.
It wouldn't have stopped somebody
the
coming
made-man
in through
era,
that RDP.
and that's to
No,
my
sir.
point.
That's correct.
Yeah, and so, boy, who monitors the cameras like in the parking garage over the holidays?
Nobody. I've said that since I've been here. We spend a ton of money on security, and we have nobody monitoring.
But we still record it for how many days?
We do record it.
For how many
It
days?
depends. What the problem that we've had, now we're fixing to bring something to the board to fix this, is we've added cameras after cameras after cameras on the same old NVR. When we bought it originally, we thought, okay, it's 30 days, but because we added 20 cameras onto it, it's now 3 days.
We don't want to put that information out there.
No, I know, but I'm just saying. It depends. It's hard to say, but we are in the process right now of getting
Okay.
bids to upgrade every NVR in the system.
So if there was a murder 7 days ago on the 4th floor coming in, we wouldn't have are you saying we wouldn't have a video of it?
We get almost weekly requests for security video from the different parking garages. I had one this morning. So,
That well, maybe they ought to put weekly security in the parking garage. It'll be cheaper. I mean, and we know what the problem is. I mean, quite frankly, I mean, murders as Claire had over in Montclair. I mean, why are we buying these systems if I can't figure out who is shooting a kid in Montclair Park?
Yes, sir.
I mean,
How do we
we might as
fix
well
that?
put a dummy camera up there and say you're being watched. Smile, you're on video.
How do we fix it to where we can record 30 days for all our cameras?
We're actually getting, the quote is supposed to be in my office by this week, by tomorrow, actually.
Is that high dollar or shouldn't be high dollar?
You know, per site, like the COC, I'm guessing it'll be, don't quote me on this because I haven't seen it,
I'm
but
gonna
I'm
hold you
guessing
to it.
around 25,000 per
25,
site.
Per site.
Yeah, so that's, oh yes, per site, yes. This building, what we want to do at this building with all the garage cameras we need to add and everything, it'll be probably, it could be up to around 40 grand. I mean, I think out of CARES, we blocked off, Wes, it was about 200,000, I think.
That's correct. Well,
So
there is the list y'all voted on.
That was included this?
Yes, sir.
Okay, all right, that's important. All right, anything else for
Yeah,
Bart?
yeah, it is. And Jeff, that's fine to bring it. I'm not going to vote for it unless we have a comprehensive plan. You know, there is enough technology, and let's not put lipstick on it. I mean, there's technology that a camera can laser in. If a homeless person is sleeping in the hallway and he doesn't move for an hour, it alerts that camera. And if people are doing things, breaking bottles, sound effects in parking garages.
Yeah.
Gunshots trigger a certain thing.
Yes, sir.
I mean, put those things in place and just not let's put lipstick on a pig. I mean, I'm just not going to support putting more cameras, with a toothless tiger, Jeff. I'm just not going to do that anymore.
I want 30 days recorded.
Yeah, and I want systems in place that can alert authorities when there are things like gunshots and bangs, and when there are people who are sitting there and don't move in a parking garage. That's the public safety part. It's great to put all this crap in that's protecting whatever data we have, but we have a responsibility to protect the citizens who live in Montclair, Brownsville, and people who come down for the Christmas holidays in this parking garage whose lives are being threatened every day by coming on our facility. So if we can't put the right security in it, close it down. And that's the park and the garage.
Commissioner, we are bringing you a holistic plan to address specifically the parking garage. The cameras is just one facet of that plan.
And please include the high-risk parks where our children, where we've had 19 homicides, where our children are getting killed.
We'll bring you a holistic plan.
Thank
Right
you.
on. Okay, so just
Can
to-
I ask one question just for clarification, make sure I meet
Okay.
what Commissioner May is requesting? So the one thing that we have not done on any of the plans that we're planning on doing is monitoring. So today, we just record. We
Right.
don't alert. So you're correct. You can buy infrared cameras that will pop a screen on somebody's desktop, but if you don't have anybody sitting there watching this big screen, it's just a pop. Nobody knows it. So are you wanting us to bring
Yeah, I
you-
think that, I mean, there's technology, as you said, that puts alerts when there's suspicious activity is happening. And then, I mean, we have a public safety department that's open 24 hours a day.
Okay.
There's a way in which counties and firms are doing this throughout the country. I mean, you know that, Bart.
Oh,
I
yeah.
mean, and I'm happy to talk to you offline
Okay, we can
about
do
it,
it.
but I'm just not going to support anything else with just putting cameras. And you may have 3 other votes that'll support it. That's great. But I'm just not.
All right, thank you, Lumen. Robert, you're recognized.
If we're finished with this, I just, real quick.
I hope we are. I think we killed it.
Me too.
Executive Director Lee, with the Island Authorities here for item 27, she has to go, so I just wanted to see if there are
Yeah,
any
okay.
questions.
But
Lee
before we
Davis.
do, and we're happy to do that, Robert, but.
Thanks, Bart.
Before we do, I just want to make sure, Stephen and Lumen, did you want me to pull any of these 12, 13, 14, or 15? No? Okay, not necessary. Okay, we're going to move to 27, and do you want to bring your guest forward, Robert?
I do, I was just saying if there were any questions on it, if not, just go ahead and let her go then.
Does anyone have questions on 27? Interlocal agreement? It's going to be reimbursed through the
Through the
Portofino
PIF,
Island.
yeah.
Yeah. I have no questions on it.
Okay.
Yeah.
Yep.
All
Some
right.
lights on the beach.
All right, so
Can
we're
we just
good.
kind of close the beach down?
No, we're not closing the beach down. All right, we're going to move forward to
All right,
16.
thanks, Lee, appreciate it.
Yeah, thanks for being here. Number 16, recommendation concerning the EMS county grant in the amount of 25 grand for the, I believe this is for the ambubus. A good, by the way, good article in North Escambia about that with pictures and stuff. All right, number 17, corrections inmate goods and cleaning supplies. Yes?
Oh, I was just going to say, yeah, shout out to North Escambia for,
That was great coverage.
yeah, well,
William
it's
does a
nice
great job.
to see things that are positive, things that are positive sometimes that are, in the community's interest,
Yeah.
good. That's a pleasant.
Now, William
change.
Reynolds, North Escambia does a fantastic job. He's a star. All right, number 17, recommendation concerning corrections inmate goods and cleaning supplies. All right, number 18, I'm looking for lights. Number 18, authorization to take action concerning defaulted contracts. This is a good thing. Nope. 19, recommendation concerning law enforcement trust. Nope. 20, recommendation concerning supplemental budget amendment, 22 SBA 28 for fiscal year 2022 leave incentive buyback for the sheriff's office. It's good stuff. All right, number 21, recommendation concerning the purchase of 3 fire apparatus for fire services.
Yeah, Mr. Chairman, I did talk to the administrator a minute ago about it. Hopefully sometime during the day-to-day, we can put our hands on, we're buying off of a contract, off the Orange County contract, which is, again, fine. This is one we've used before. There's a handful of others we've used before that other agencies use. But we need something in the backup that's giving some narrative and some documentation for not just, is it legal, which it's legal, but why this is the contract that we're buying off of versus the Lake County contract, or there are other municipal contracts that exist. Just something that shows that, and that would be related to 21. 22 does have some backup with 2 vendors off of that state contracts, off that Sheriff's Association contract, so 22 is, I'm good with that.
Okay.
But 21, 23 would need to see something similar. Let's see, I think that's it, those 2.
Okay, Eric, is your team able to forward that to Commissioner Berry and the rest of us? Email
That'll
it?
be Jamie Higdon.
Jamie?
Public Works, yes, we'll get that.
Okay, all right. Robert and then Lumen.
Let me have something on this. I was going to go back an item.
No, Jeff, I was just going back because we just had some sheriff, like 2 seconds.
Oh, yeah, okay, go ahead.
And thank Chief Simmons, Chip Simmons. We had a lot of shootings, a lot of murders within my district, even some in your district, Jeff. And I've been able to be with the sheriff and his team, and we've solved quite a few shootings. We got a lot more to solve. But throughout this holiday season, the sheriff was very, very accessible, and I wanted to thank him. And we just had his issues. I do want to thank the sheriff.
Thank you, and I will echo that sentiment. Robert, you recognize?
Yeah, I was just saying I think we had said we were going to fund $800,000, and this is.
It's higher.
22% higher. So I guess if you're talking to them, I know, we need a budget too. And so just also want to recognize that we're giving him an extra $181,000 for this. So,
No, it's, and this year, Robert, I'm glad that you brought that up because we really didn't, we essentially met his budget that he brought to us, which I think that's a good way to start the relationship given the previous history with his predecessor. But my intention as chairman, unless someone stops me, my intention is to pursue a 4-year deal. I think it makes sense for a lot of different reasons, and I want to mirror whatever we can do with the sheriff's deputies for our corrections deputies in our jail. I think a 4-year deal would help us with retention, would help us with recruitment, and I think it's good. And I think if folks can see that there's buy-in from this board and a commitment to the long term, it'll get us through the next couple of years without having to just sign off on a budget. So my intention, I'm going to run till I get tackled. But
Mr. Chairman, we did meet, as you pointed out, we did meet the request, which should be a tremendous amount of goodwill.
Yes, sir.
Absolutely, we did.
Hypothetically, what you're saying, that sounds reasonable, but my support for it is all going to come down to
what it costs.
Yeah, what the details of the
Sure.
details of the agreement are. And you recall some of the discussion when we had a multi-year agreement with the predecessor was, you know, I had some reservations, and you know, we shared those publicly, and a couple of us, I think, voted against some of those terms in the agreement, and you know, it's going to come down to what, you know, not just trying to get an agreement that they will agree to in place, but what are those terms? What are the terms in that agreement going to be?
Absolutely.
Because, you know, it's
And
we certainly can't do what was done this year
every year.
repetitively.
No, it can't happen. We can't afford to do it. We don't have the money to do it. So I can assure you, Stephen, and I agree with you. Obviously, it's going to be something that we sit down and it'll be brought to this board, and you know, and then we'll each of us will weigh in, and then hopefully we can get it done. But I do think.
And Jeff, I appreciate your leadership. I think the last time we had a multi-year agreement was under your leadership as chairman. I just would hope, and obviously, you know, I've been very, very supportive of law enforcement, and I probably was one of the few people that didn't want to take in a jail. And so, you know, as Commissioner Berry said, when the agreement was brought forth that you brought, I was very supportive. There's some things that, you know, I didn't like. I didn't like the bullying. I didn't like, you know.
Yeah, it was horrible.
I didn't like, you know, the idea that someone says that they could, you know, run to the governor. I mean, would assure you that we were more friendly in our distribution than you would have gotten out of Tallahassee.
That's a fact.
But I do understand that the importance of public safety and incarceration of those who have violated. But I certainly have a deep appreciation for prevention and safety before it's law enforcement. So as we look at our resources and as we distribute them, it's important to me that, you know, through our human services, that there are prevention dollars, and also as we decide to give increases, that the equity among the least of them, from the custodial to the administrator to law enforcement to public safety to accounting to engineering to all those who decide to go into the public sector, into public service, that we compensate everyone fairly. And I certainly know that there are high-risk jobs, and certainly people who put on, you know, a badge and a gun every day are certainly taken on. But I can just tell you, our correctional officers are going in a COVID-infested jail every day, risking their life with people who are committing suicide, people who have just murdered people. They have to be compensated as well. And so as you look at this, I just would ask that you be all-inclusive of the overall budget and the mission. And I've said this since I've been on this board. You know, what is the 5, 10, 15 strategic plan of this board for implementation? And law enforcement obviously is the largest portion of that, but we need a holistic approach to what we do with funds. Because if not, we're going to be stuck. And as you've said, you'll never vote to raise taxes. I mean, if we continue to give increases, increase expenditures, and we have a flattened revenue, we become in trouble. And at some point, you're going to have a housing bubble that's going to burst, and we're going to have some lean years in years to come. And when you have those lean years, that's not an opportunity to reduce salary of employees. So we should plan, you know, for the famine and the feast. And so that's what I would just say to you, Jeff, as you move forward. And I would just hope that you take it methodically and slow, and keep in mind everything before we just have a open conversation.
I appreciate that. No, and that's my intention. That's why I'm going to tie in the corrections deputies as well, because I agree with you.
And please consider everyone else.
Yeah, and then of course, yes, all the other bargaining groups, and I would be remiss if I didn't take an opportunity to thank Wes and his team for the swift way they've closed so many of these books this year. Really appreciate that, and it looks like this afternoon we have the opportunity at 4 o'clock to do another one. So we kind of segued a little bit, but I believe that we are back to 21. Did you want 21 pulled, or are you okay, Stephen, if they give you the backup on 21 and 3? Are you good? Okay, so moving forward to, we're going to go next to 23. We were on 20. I think we moved forward beyond that. Okay, we're on number 25, recommendation concerning the contract award for collection of disposal household hazardous waste. Number 26, recommendation concerning the issuance of purchase orders related to Hurricane Sally in the engineering department. Yes, Robert, you're recognized.
So, Stephen, if you have something on topic, I have something.
25.
Go ahead then.
Yeah, and we have talked to folks in solid waste, but we're going to get this request out of purchasing pretty quickly.
Okay.
That's, well, it's a question, I guess.
Oh, you're talking about 25,
Yeah.
Stephen? Wes?
We can certainly make it a priority.
Yeah, apparently it's been in purchasing for many, many months. And the feedback that we got was that we're having to do something in the interim until purchasing can get a formal bid out. And the months go back to the summertime, apparently. So if there's something we can do to prioritize this, I don't know how many vendors there are or anything like that, but it's not ideal, certainly.
Understood.
Okay, all right. Number 26, recommendation concerning the issue of, is that the one you were talking to, 26, Robert?
In a general sense,
Okay.
I'm just looking for some board approval that when I go to Tallahassee, I want to meet with our lobbyist.
Yes.
And hopefully some state departments and leaders about some reimbursement for Hurricane Sally. Notably, see if the state would be willing to assist us in our 12.5% that we have to pay in FEMA. I know they've done that in neighboring counties
Yes.
over the past ones. And then the other thing I'd like to talk about with them is the O&M requirements, which are the obtain and maintain requirements from FEMA. And so what happens, like with the ECAP building, because we received FEMA funding from those in Ivan, FEMA won't help us on the
Again.
current damage that we received. And I believe the current damage is just slightly over what the deductible would be in insurance. So we covered the insurance, we met those requirements, but so now we're having to pay the full deductible amount, and I don't think we're getting any help from FEMA on that. So I was just looking for board support to allow me to work with our
I think that sounds reasonable.
lobbyists to have those discussions in Tallahassee.
When are you doing legislative day?
Yeah,
When?
2 weeks. Yep.
Robert, since you're talking to people about reimbursement,
Yeah.
let's also talk about the jail. That came to my attention because a judge told me, well, I heard from a judge that the sentence that they imposed wasn't being carried out. Entire sentences were being served that should have been in the state prison system in our jail because, the state is having issues with hiring people and
Right.
space and kind of like the same issues we have. And that, as anyone who watched the news last night knows, I asked questions and I found out we had 136 state prisoners, some of whom have been in here for months, because the state's not taking them. So that's a fact, yeah. Do you want to come forward, Rich? 130, well, there might be less now. Each day a few go, but then more come in, and we have over 100 right now. And
Oh, wow.
Yeah,
That
and-
shouldn't even be,
And so when you're in there talking about that, let's try and get some of that money back, because that's a tremendous amount.
Well, I did see that last night, so there'd be that. There would also be we're also working on the medical costs.
Yeah.
For those same inmates. I mean, that's just the $90 a day was just to
Exactly.
house them. That's not counting their medical.
And their medical is overwhelmingly expensive. Yeah, and to put it in perspective, Robert, and I appreciate, Rich, you being here, if it's a federal prisoner, they pay $100 a day per head, per day, and medical costs 100% reimbursed. You send them a bill. And so these state prisoners are costing us a
Hey,
fortune.
I saw some of the comments online. We're not paying the inmate $90 a day. That's what it costs us to keep the inmate.
Precisely. And that figure, some people said,
just
well,
to clarify, anyone who saw that was.
Rich, how is that $90 figure arrived at?
What's our total budget divided?
Can you speak into the mic?
Oh, yes, sir.
Thank you.
It's our total budget divided by the ADP, the average daily population.
Okay.
is
And
how
it's
we-
$90
how we
a day.
estimate it. It's roughly that. It fluctuates depending on what month we're in.
So,
But
yeah, we need to get that money back.
In essence, yes, sir.
you know-
We were over 100. I don't have the exact number. We shipped 22 yesterday. And that's over what they asked. I work with Tallahassee every week. We had a period that we were only.
go back, you said it was over what?
I'm sorry?
You said.
It was well over 100, and we shipped 22 yesterday. So we're probably right around 100, depending on how many came out of the courts yesterday with sentences.
That's right.
And that's an ebb and flow as we move through the weekly period.
And they've been there for over a year, you said?
Some of them.
Is that because of COVID and the court system shut down, or
Well,
is
it's a
that normal?
combination of the backup that we had because of COVID, as well as the reduction of staffing availability, and them being DLC, Florida DLC, reducing their staffing and facilities. They consolidated a lot of their workforce, which limited their bed capacity. They shut down several actual prisons and consolidated their staff. That way they could make their manning.
Have we got the building across the street back from the state, that correction building? yet?
We still own it technically via contract, or it's our building, but it's still under contract. We're working on another aspect of it.
When can we start using it? The state hadn't used it in over a year.
That's something going on at the board level, or at.
Well, this is the board.
Well, I'm at the senior level as far as managing that contract, sir.
Well, I mean, I want to know, Wes. I mean, because, there's been several requests for that building.
We're looking at Harding, the old work release center, and then we're also looking at options to look at the old state work release center as
Sure,
well.
that's what I'm saying. Can we get, Debbie was coming, can we take control of that building? They've not used it. I mean, there has to be a clause in their lease for abandonment.
Yeah, we're working, or it's being worked.
We do have a clause that we can terminate. We have been working with them. They have asked to keep it, so we haven't terminated it yet. There may be
On
some-
what grounds? For future use?
Yeah, I think they're trying to privatize their state work release, is what we've heard.
Well,
So-
if we can get out of the lease,
Yes, we can terminate
well,
it.
they don't have the ability to assign that building to someone, do they, legally? Allison?
We can terminate it.
Yeah, we're not gonna, yeah. That's what he said, $90 a head, that they want tax dollars to privatize it. No way I'm gonna vote to give our
Hey,
building to a
Lemon,
private company.
Yeah, when we went to the sheriff's luncheon, when they.
They mentioned the
They
building.
mentioned about how the sheriff's department would also like that building.
Yeah, they would really like
But
it.
we like it
But-
first.
Yeah.
Yeah.
Because we need it. I appreciate the sheriff, but, we got a leaky building, we got a problem, we need to
Yes.
put our inmates somewhere, so. yeah.
Right.
But if we don't, I agree, the sheriff
Yeah.
could use it, but.
Now, we also have
need it
our other,
first.
we have our other work release building.
Well, we are looking at some scenarios as we're coming in.
We got two buildings that we could
We may
use.
need
We got two.
But there's no doubt we're gonna be doing renovations on that old jail sometimes. And rather than getting caught when it crumbles, we should have these two buildings ready to put inmates in, so we don't send them to Walton County to buy their administration nice Crown Victorias.
Right.
Yeah, and that's because that's what we did.
And Lumen, before I recognize Robert, you bring up Walton County. I will say Walton, Okaloosa, Santa Rosa, they stepped up when we needed their help. When we had a capacity problem because our jail blew up, they took in our prisoners and did everything for them.
Oh, I
But
appreciate
not for
it, yeah.
free.
Not for free. That's
We
what I was
paid
gonna say.
millions of dollars, but essentially the state has problems. They've got the same problems we have, staffing, facilities, bed space, but we're not getting paid. We're not
Right.
getting paid. The local taxpayers are paying that, and the Department of Corrections is correcting their issues on the backs of local jails.
I like what you just said, Jeff.
And that needs to be fixed. And so I was very loud and vocal with Representative Andrade and Representative Salzman, both of whom did not seem like they were aware of this issue. Now, Senator Broxton last night on TV said they had plenty of bed space in the state, but I'm hearing you say that's the reason why they're not transporting. What's the truth? Do they have a lot of bed space? If so, I'd like all 100 of these people sent.
Well, I'm not aware of what their bed space is, sir, but I can tell you that they had to close facilities to
They've
make their
closed
manning.
facilities.
They
Well-
closed facilities to make their manning.
Well, whatever we can do to expedite, I know you're working hard with your counterpart, and we're not trying to punch anyone in the face, but if we're going to hold excess prisoners for them, we should be compensated. When Walton County held excess prisoners for us, we paid them $55 a day, and it added up a lot. So one of the things that we're going to do in his monthly jail report, we're going to start adding the number of state inmate convict days that we're shepherding and supervising these prisoners, and we're going to find out a dollar figure, and it's going to be running total, and I think it's going to be an eye-opener for this board. It's a lot of money that our local taxpayers are paying, so I'm glad you brought that up, Robert. Otherwise, I wasn't going to bring it up.
Well, just tell us that
Glad you
we'll
did.
release them, Jeff. If they don't want them,
Well, we're not going to
release.
really. The dirty secret is these are not low-level drug offenders. These are murderers, rapists, guys with 40-year sentences, life sentences, sitting in our jail, combative with our guards, combative, fighting with our guards every day, and they're state prisoners, and we're paying for it.
And medical.
And medical.
So, Chief, how long would a typical stay, and I say typical, let's say pre-COVID, how long would it be before, after an inmate is sentenced to the time that they would be transferred?
It was always a matter of a few months.
That's still a long time,
That's too
though.
long.
Absolutely. It always depended on how many we had. We always sent our worst and the longest sentence, if you will, first. So an inmate that is non-combative, non-problematic, not a medical cost to us, they're a low priority ship for us, and we we transfer all of our high cost, high liability, and problematic inmates.
Yeah, but I mean,
They're
that's
front-loaded.
still insurance. I mean,
time.
that's staffing. I mean, that's putting a burden on our staff. It's putting a burden on our bed space, in which we're already overcrowded.
Correct.
We
Correct.
don't know staff now. it goes on down the line of the trickle effect that us holding their inmates has when they're just pushing it back on us.
And the funny thing, Robert, it never would have come to my attention, but here's the important thing to know. The judges, when they give their sentences, they're very deliberate about it. They might give a guy 6 months, the same guy, 8 months, the same guy, 10 months. But eventually, they give a month and a day on purpose, because a month and a day means you're going to state prison. And they do it on purpose because they want that person to get on the bus, take the ride, and understand. They sometimes do it because they want people to get back on track. When we circumvent the judge's sentence by the state not taking the prisoner, the sentence isn't being carried out. The judge said state prison, and they're doing a year in our jail, and we're paying for it. So there's multiple problems, multiple layers. So Robert, I appreciate you taking the leadership, and I just expect that you'll get it solved on your one-day trip. Thank you for that.
I'm a couple days.
Yeah, Jeff, I mean, it's going to be a committee of the whole, but when we're talking about spending $90 a day on a person, I mean,
it's too much.
It's way too much. In the analysis, what do we spend on prevention to keep a child from going to jail, and what do we spend on in workforce? And Wes and I talked about that. That's really the key. You can't incarcerate your way out of that. But when you say $90, as he said, that's your overall budget divided by your population. But you have some people that cost you a couple $1,000s to keep there,
right.
and
Heart disease,
heart
dental.
disease. So that's and then there's a multiplier effect. I mean, commissary that we make. Inmate commissary, phone calls, there's revenue that comes back in. And so actually to say $90, that's the mean, it ain't the mode in terms of statistical data.
I don't disagree.
Yeah, I mean,
what
so
that
that's
actual number is probably impossible to quantify, but it's
yeah.
too much.
It's way too much.
It's too much.
$50 is too much. Yeah, $10 is too much.
We need to be paid.
Yeah. So we got new lobbyists, so maybe they'll earn their
All right.
keep, Robert.
All right, you guys ready to move forward? Okay, we're on number 28, gentlemen. Recommendation concerning the funding for an intersection improvement project at Johnson's Beach Road. All right. That'll be a nice addition to District 1. Looking forward to that. All right. And wait, how are we paying for that again, Joy? How's that being paid for? Joy, can you come forward, please?
Mr. Chairman?
Yes.
We did a little bit of work related to that, and it is, it references in the narrative that it's being paid for from discretionary dollars.
Correct.
But then the table shows it coming from the admin reserves.
That's why we got to make sure it's coming from the right pot.
Yeah, apparently per conversations with budget this morning, it is coming from the District 2 discretionary dollars that are a subset of the admin reserves portion.
Okay.
Sometime last year, the previous budget director combined all the discretionaries into the admin reserves.
Yeah.
But it is, and it apparently still has, even though with the action that we took a couple months ago, whenever month ago, there's still a couple $1 million of discretionary that he has, and he does have this much, but this is coming out of that based on my conversation.
Okay. So it is District 2 discretionary.
Yes,
Doug's
sir.
going to pay for it. Okay, perfect.
That'll
That's
be
even
the
better.
action.
But let me ask you this. I was told, and of course that was a part of District 2 before, it's part of District 1 now, but I was told that there was a significant public meeting and that the public wanted this roundabout. I mean, I'm agnostic on roundabouts.
Yes, sir.
Ask Grover. I supported it when he wanted them at the beach, whatever. It was all about the money. But is that true that the residents out there, that's what they want?
They voted.
Okay, and how many people took part in that? How many people were there and voted? Was it?
It was 64% as far as the majority.
I don't
picking
care
the
about that
roundabout.
number. I want to know, was it 15 people showed up for
I would
coffee and
say
said, 8 of them wanted it?
50?
No, 15. Oh, 50?
It was
It was a
packed
room
out.
full of people.
Room full of people. Okay, so, and there was a 64% of the 50 wanted it.
Yes. I can
Okay.
give you actual numbers if you want.
I mean, I've had no phone calls on it. I've had no emails, so
They-
I assume,
They had 3 choices to vote for.
Okay.
1 roundabout, 1 a signal, or 1 do nothing.
and they wanted the roundabout.
That's right.
All right. Well, I look forward to doing it.
Just since you bring it up, did y'all make a recommendation? Were y'all recommending something?
We presented both, pros and cons, and let the community decide.
So nobody recommended what was best?
Just pros and cons for them to.
Okay. Mr. Chairman, I think one of our colleagues has departed. I know we haven't quite made it through the agenda, but
Sure.
you want to go ahead and break?
I'm fine with it. You just want to close this meeting out? Because, I mean, we've all done is there anything else on here that anyone wants to talk about? Robert?
I think, Wes, are we dropping car 33?
Yes, we need to drop car 33.
Okay. And yeah, I really don't have anything else on any of this.
We've addressed most of the stuff that I had an issue with, and I'll be looking for some information during the day today, but I'm good with the rest of, the majority of the budget and finance portion, Jeff. And then, maybe we just kind of pick up discussion when we get there, but we're dropping one of the discussions, so.
That's fine. And then was there anything that you all wanted to ask Allison about her report?
No, and, the area housing thing, I'm gonna, if anybody's gonna have some feedback, it may very well be Commissioner May, but he's out of the room. I saw your appointments, I'm good with all those, and we're dropping 3. He's gonna, no, I'm good with Allison for my part.
Okay, very good. All right, well, gentlemen, then.
Hey, sorry, Jeff.
Yes, Robert? please.
Are you putting yourself back on PEDC?
Yes, I am. Absolutely.
Because there's
yeah.
only one,
Yeah, and I wanted to ask staff about that. I think I'm still a carryover from last year, if I'm not
I
mistaken.
nominated Stephen.
Okay, so then I will add myself back, because I'd like to.
Yeah,
I'd like to
you're the carryover from, no, Stephen's the carryover, you'd be reappointed.
I need to be reappointed, so I'll go ahead and make that change. We'll add myself to that.
Just something that references both of our names is probably sufficient, doesn't really matter what the terms
Yeah,
are.
I'll do it at the table tonight. Robert, thanks for reminding me, and I appreciate that. Anything else, Robert? All right, gentlemen, then with that, thank you, ladies and gentlemen, we're adjourned.
Allison?